This conference will now be recorded.
Okay. Who wants to start the first case? Anybody wants to start? The first case. Sorry. Who wants to start? Anybody wants to practice? Okay. Guys, can you see us and can you hear us? Yeah?
Yes, doctor.
Perfect. Okay, let's start the first case. I will pick one of the academy and then one online. One from here, one online. Okay? And all difficult situations. So just be yourself and let's see. You gonna come? Or you know? You can try. Anybody who's ready for the exam? Anybody who's ready? No. So why are you upset? That's cancelled. No. Yeah. Anybody who was like, yes, I was ready. What about you? Gonna come? No? Okay, let's start with the online doctors. I will pick one of the online doctors and then we can pick one from here. Okay. Guys, tomorrow we are having dinner together here, yeah? So let's gather and just, yeah, have some fun. Yes. Yes, yeah, let's relax, you know. We're gonna make it like at 4:30, so by then you all if you wanna practice or something, and then we're gonna have, okay? So let's pick one of the doctors. By the way, last year the same happened with the exam cancellation. And that's when we carried on practicing and carried on online mocks and carried on, you know, studying and carried on. And trust me, the results are better than before cancellation. Because, you know, you need to, seriously, yeah, you understand that my course was like 12 days, the old one, yeah? The old course used to be 12 days. And then when they stopped the exam, it became 45 days. These days was like every meeting and yeah. Can you switch off the mic, please, if you don't mind? The mic, please. Mute the mic, if you don't mind.
Will the session be recorded, Dr. Mo?
Sorry?
Will it be recorded?
Inshallah.
Okay, thank you.
This conference will now be recorded.
Okay. So Dr. Rami Fadl.
Yes, يا باشا.
Yes, doctor, how are you?
Fine.
Good?
الحمد لله.
Good. Let's start.
You sure?
You are an FY2 doctor in the GP clinic?
Yeah.
Okay. Your patient is Ashwarya Roy. Yes? Ashwarya Roy. She is 25 years old. She's coming with a concern. Talk to her, address her concern.
Okay.
Dr. Osman, can you switch off the camera, please? Dr. Osman sitting with his friend, both of them, and they open the camera. Seriously, two together, like, yes, let's start.
Yeah, let's start.
Yes, I'm ready. 8 minutes, Dr. Amar Sobhy. 8 minutes. Always the nowadays in the exam, concern. They don't write what concern. Okay? Okay, let's start. 8 minutes.
Yeah, let's go.
Yes, I'm ready.
Yeah. Hello, good afternoon.
Good afternoon.
My name is Dr. Abul Fadl, your attending doctor for today. May I confirm your full name and age, please?
My name is Ashwarya Roy, and I'm 22 years old.
Okay, how would you like me to call you?
You can call me Ashi.
Ashi, how can I help you today?
Well, I want to change my counselor.
Yeah, I can understand you have a concern, but what do you mean changing your counselor?
Well, I used to have some counseling sessions by one of the counselor, and I want to change him. I don't want the counselor anymore.
Okay, I definitely understand that you have a valid concern. But in the first place, may I ask you why you are taking counseling?
Well, I used to have these counseling sessions because I'm going through depression.
I can understand. And how is your depression? How is your mood now?
Well, can be better. It's all right.
Yeah, so I mean, how is your life in general? I mean, you're doing the same life you are doing before, or you found some improvement after you visited the counselor?
Well, at first there were some improvements, but now I feel like I'm going back again to where I was before these counseling sessions.
Okay, I understand. But may I ask you, why in the first place you got to the counselor? What happened?
I just found out that my boyfriend was cheating on me, and we were together for like 7 years since I was 15. And then after 7 years relationship, I found I was cheating on me, and that was a shock, the biggest shock of my life. And that's it. It all went downhill after that. And then I went through so much depression because, I mean, I thought I'm not good enough for him, and I started like losing my confidence, and that's it. And then I found like this counselor that I was advised by my psychiatrist that I need to see a counselor for talking therapy, and that's it. I feel I just don't want to, I don't want to see this counselor anymore.
Yeah, I totally understand. You must have had rough times the past few months or this past time, but life goes.
No, it's not the past few months, doctor. It's the past
Um,
few weeks. How do you know it's
past.
the past few months, doctor? Just few weeks.
Okay, sorry for my assumptions. Okay, and you mentioned for me that you don't want to see your counselor anymore. May I ask you why?
I'd rather keep it to myself. I'd rather not talk about it.
Well, actually, I can see you are upset, but I am here to help you. Can you open up for me, please?
No, I'd like to keep this to myself.
Yeah, I totally understand that people when go through rough times like what you are experiencing, they tend to be in themselves. But I'm here to help you.
No, I'd like to keep it to myself. I just don't want to talk about it. Talking about it just brings things that I don't remember.
Yeah, I can see you are really upset, but I will try to help you as much as I can. So, can you please consider opening up for me?
No,
Okay, I
I don't want to
understand.
talk about it.
I understand you are hesitant to open up for me and you prefer to keep it for yourself. But I'm trying here to help you. So, can you consider open up for me?
No,
So, actually, what do you fear if you will open up for me?
nothing about. I don't feel comfortable talking about these things.
Yeah, I can see you are anxious and upset, but I will try to help you as much as I can. So, can you consider it?
No,
Well, actually, I can see that you don't want to open up, but do you know that everything you are saying to me is confidential between me and you and the team?
you see, me and you and the team. No, I don't want to talk about it.
Sorry, actually, for my expression, but do you understand what is the team?
Yeah, the medical team.
Yeah. So, any problems with it?
I don't want to fucking talk about it. You've been fucking convincing me for like five. I don't want to talk about it. I told you that brings bad memories, that brings bad things. I don't want to talk about it.
Yeah, actually, I
Are you
can
gonna change
understand.
the counselor or not? I don't want to talk about it.
Yeah, definitely. I will try to help you with that, but I need to understand what's going on so I can help you in the proper way. So can you rethink about it? Can you open up for me?
No.
Okay, so I will try to help you with the changing of the counselor. But may I ask you about another things in your life? How is your health in general?
Perfect. Medically fit and well.
Yeah. So and how's your life? You told me you think you can be better.
Yeah, I mean, I'm just going through tough time again, but
Did you give us all to talk anybody like your friends or your family?
no.
May I ask you why?
I just don't want to share it with anyone.
Okay, so did you thought about being attending any groups, for example, anonymous groups, so nobody will knows?
No. Anonymous group to do what?
To share thoughts, I mean to vent what's going on through your mind.
No.
I really understand you are passing through a tough times, and I'm really hoping to help you as much as I can. But can you please even give me some hints what's going on so I will be in a better position to help you?
No.
Well, okay, Hashi, I understand. So anybody else, I mean, you will feel comfortable to talk with. I can provide for you.
No.
So I can understand your main worry now is the change of the counselor.
Yes.
Okay, so may I ask you how many sessions you attended with him or with her?
I've attended 4 sessions.
Okay, and how was the first couple of sessions?
Yeah. The first couple of sessions were all right.
So did you notice any improvement while attending those sessions?
Yes, at first I did.
Yeah, and then what happened next?
I just don't want to go through this. I don't want to talk about it.
Yeah, I can feel you are really upset, and I'm sorry to before bringing such memories. But
2 minutes remaining.
would you consider opening up so I will be trying to help you?
Back again, doctor, for the same dilemma. No, I wouldn't consider opening up. I don't want to talk about it.
I totally understand your point. So
You don't.
I mean, I understand your point, and I can see from where you are coming from. But do you know, like, if you didn't at least give me some hints about it, I will not be in a good position to help you. Do you understand that?
Yes, I do understand.
So I mean, I don't want your health is my concern. You know, I don't want you to go through any rough times or any bad memories again. So let me help you.
Okay, all right.
Okay. So can you tell me what's going on?
No,
Okay. So I believe this consultation is not going to the correct way. Would you mind if I will call my senior? Maybe he will have a successful conversation with you.
yeah, you can call him doctor.
Okay. So actually, please, if you felt like more down, more than this, I will call him for sure, and definitely will try to help you. But if you felt more down, please call us directly.
Okay, all right.
Okay. I'm done. I don't know what else I can say. I tried all the options.
Order.
Okay, Very common OSCE station. Have you seen it?
Yes.
Very common. Very common, yeah? Okay. Dr. Rami,
Yeah.
I would give him in this station 111. 1 out of 4, 1 out of 4, 1 out of 4. Okay. By the way, before we go through anything, our main concern is how to approach things better and how to be good. Not that I'm not here to try to put you down or put you off or make you. No. I've done the station. I didn't do well. Okay. That's how we should do it. And that's what I want you to know. How to do it, not because some doctors, they think I put them down by giving them an honest feedback and clear feedback. They think you putting us down. Guys, that's not the exam. Get the feedback, improve your station, and move on. Don't think about my feedback or my score. You get me? Okay. Why do they keep bringing such a scenario all the time? Because we keep failing. As simple as that. Because if we keep passing it, if we know what to do, it's not gonna come again. Do you agree with me?
Yes.
So that's it. It's a question that keeps coming since I was preparing for FLAF 2. It's like one of 4 years back now. We come until now. It's very common. Okay. Why? Because Dr. Rami and everybody else acts in a certain manner that is wrong, and in a way that when we read the script, we think this is the thing. That's how we read it. That's how we do it. No. This case, a patient wants to change. The first word that comes out of my mouth, definitely I can change the counselor.
Yes.
He's never said it till the end of the session. And he's always kept saying, he kept saying, well, I write down, yeah? So in case anybody think, if he would have said it, I was waiting for it, yeah? So definitely I can change the counselor for you. So the forward conversation that you're going to have, it is just for you to know what's happening. If you can't, move on, change the counselor and do other things. But the counselor will change anyway. But Dr. Rami, till the end of the stage, he was talking to me as if you don't help me, I'm not going to be able to help you. If you don't help me, I will not be able to go forward and address your concern. No. Hi, how can I help you? Doctor, I want to change my. Definitely, we can not help you with that. We can change the counselor. It's fine. Even if she doesn't give you a reason. Even if she doesn't open for you. Even if she doesn't give you any course. Let's agree on that's the start, that's the approach. Definitely you can change it without a reason. Without a reason, yes. Later on, I'm gonna start finding out what's happening. But if I don't know anything, 100. No, that's the rule. Guys, can you mute your mic, please? If you don't need the session, leave the group, leave the meeting, please. So this is the first line. After confirming identity, my first line is. Definitely I can help you with that. Definitely we can change the counselor for you. Do you have any preference? Do you need a male counselor or? And that's it. Then start. Is it okay if we have a chat in order to be in a better situation and in order to understand things in a better way? Then you start taking history. But the counselor, 100% you will start like this. Clear? Yes. Guys, this is the start. This is the approach. This is everything. This is what everybody is expecting from you. Yes, we'll change the counselor. Yes, if there is no reason, I will do. Yes, if she doesn't want to open, I will do. But Dr. Rami was relating it. I have to give him a reason for him to open. So then I will start. But is it okay to have a chat in order to get to the bottom of this, in order to be in a better position? Yes. And your chat will include 3 words. That's it. And the session is finished. How many words? 3. You remember when I was giving you the session of dermatology and I was giving you words. This chat I will include 3 words. The first word is the counseling sessions. The second word is the counselor. The third word is the patient, her, herself. So how many words? Her, the counselor, the counseling sessions. This is my station. What do you mean, Dr. Mo? Her is how do you feel? Why are you seeing a counselor? Doctor, because I went through depression. Was it a kind of counselor only, or were you on medication? Because you want to know, maybe she's in having a counseling sessions as well as, you understand me? So now I said 3 words here: the patient, the counseling sessions, and the counselor. That's it. If you put a map in your head that this is my station, you're not gonna miss anything. It's not haphazard, the history. No. The patient. Can you please tell me, why have you been seeing counselor? Doctor, because I was depressed. I'm sorry about that. Since when have you been depressed? Doctor, for about a year. Yeah? Was it only counseling, or did you get prescribed any? If she said yes, medication as well. What medication? Are you compliant to the medication? How is your mood now? How is your mood now? You want to assess her mood now. How do you feel now? How's your mood now? Okay? This is the story about the patient. And by the way, make it, you don't need to memorize it. No. What happened? You know, this kind of chat. What happened? Guys, it's a chat. What happened? Why you see counselor? I was depressed. May I ask the reason? What happened? You know, was it just sessions and medication, or any other treatment like medication? How's your mood now? How do you feel now? That's the patient. Okay. What's the second word? The counselor, and the third word, the counseling sessions. So let's see the counselor. Okay, let's see the counselor. May I know the gender of the counselor? Was he a male or a female counselor? For how long have you been seeing that? Counselor. So every question will have the word counselor, because I'm asking about the counselor. For how long have you been seeing the counselor? Okay. So were you happy with the counseling sessions with him or with her, whatever gender he gives or she gives you? Okay. Was there any issues with the counselor, or did you find they are benefiting of him or her? Yeah, whatever, you know, like as a question, him or her, depending on what she gave you, her or him. What is the third word? How often? When was the last session that you had? Did you miss any sessions? Imagine, guys, I'm giving you a scenario now to give you the importance of missing sessions. Imagine if this lady, this girl, she was on a sessions twice a week, and she has missed, before she come to you to tell you I don't want him, she might have taken some time to take the decision and come, and she missed about 4 sessions. So in your management, is it gonna be the same as if she didn't miss any sessions? So if she missed sessions, you're gonna say right away, I'm gonna have to reschedule the sessions with the new counselor as soon as possible, as you missed some sessions and that's not good for your treatment. You understand me? But with the other situation, she might say, no, the last session was yesterday, I had it, and I came today to tell you I don't want him. So the urgency is not there. Do you understand me?
Yes.
Do you agree with me? Yes. It's just logic. Logic, which is not in any scripts, but logic, you know? So the sessions, how many? Which is how often? Since when have you been having the sessions? Okay. Where did you used to have the session? Where what? Where did you used to have the sessions? Dr. Mo, that's not a logic question. It's not really important. Maybe she was having the session in his bedroom. You never know. She's vulnerable. She's what? She's depressed. Depressed, vulnerable patient who had problems in her, you know, like whatever problem she will tell you from when you ask the patient, why were you depressed? What happened? Maybe, you know, and then now the sessions, because she's vulnerable, maybe he was having it in his house, for example. You know, come to my house, we're gonna have the sessions there, maybe in a coffee shop, maybe you understand me? You need to know the setting of the session. What did you used to talk about? What did you used to talk? Because she's vulnerable, you never know, because now, yeah. But one thing, that if you show me in this station, I will fail you the station. Do not Show me that you think of a relationship between them, because you don't know. So I might come to change my counselor, yeah? Yeah? Maybe because I had a relationship with her. Maybe she is racist. Maybe she talks about religion and I don't want. Maybe. Do you understand me? So one thing, if you show in this station, you will fail. If you show the examiner and everyone else that maybe there is a relationship, because it's not going to be mentioned in the stem. It's not going to be mentioned in the stem. It's not going to be mentioned in the question. It's not going to be mentioned anywhere unless she tells you. And if you speak in a way that, yeah, maybe there is a relationship, or if you say it, you fail the station. Do you understand me? Because you can change, you might come to change a account for any reason. But because we know it's a relationship, so we always, show it. Yeah, anything? No. Are you sure? Nothing. No, no. Can you open for me? Did he try to? Huh? No. So don't show anything. Just be yourself. It could be any reason. Okay. So the counseling sessions, the setting, how often did you miss any sessions? What did you talk about the session? Yeah. Did you find it beneficial? What did you find? What the session? Guys, as I told you, the three words. The word has to be there. When you say counselor, all the questions include the word. When you say sessions, all the questions include the sessions. Did you find it beneficial? If she said yes, that's a trick for you to make her open. If she said yes, I found it beneficial. So then why don't I change it? Even though you found it beneficial, why don't I change the counseling? And this is the station. Your management is definitely we can change. If she opens, it's okay, depending on what she opens. If she doesn't open, it's fine. But in both cases, definitely management definitely will change that. If you find that the sessions are missed, so you need to see the counselor as soon as possible. And in all cases, as you can see, I'm giving you a structure, and you can go anywhere in the structure. I'm not giving you a one situation, because it doesn't happen. People keep failing because they keep changing the settings, and you keep going into the same track, and you keep not changing, and you keep making them feel that it's a relationship, and you keep failing. That's it. No, we're gonna go like this. Okay, and then so in all cases, the management is definitely we can. In all cases, escalate to the senior. All cases, if she opens or not, regardless. But escalate to your senior because there's something dodgy here. So in all cases, what? Escalate in all of them, and in all situations, I will change definitely and make it, guys. Definitely you can change the counselor. Okay, so definitely you can change the counselor, and will escalate to the senior. And in all cases, you will, if you see that the mood is low, as I showed him, yeah, you can refer me back to my psychiatrist, because as you can see, I was low. Yeah, psychiatrist for anything else apart from the counseling sessions. Guys, counselor is not psychiatrist. Yeah, do you know that? Counselor is not psychiatrist. So this patient was depressed, you can refer 100%. Why in this station I will refer? I said to him one phrase, nobody noticed. I'm going back to where I was before the sessions and before the treatment. Did you hear it?
Yes.
Dr. Rami Fad, did you hear it?
Yes, I heard it.
For this psychiatrist, back again, yeah. And for this, definitely will change the counselor. Definitely we can refer to psychiatrist, as you told me that you're going back. And when I said to him, I'm going back to where I was, you should say, what do you mean? Guys, that's active listening. That's active. This is what we active listening. What do you mean by going back to where you was? What do you mean by that? Yeah. So station is finished, and that's the structure. That's the outline, and this is how we're gonna go. And this is the 3 words. How many words? 3 words. Patient, counseling sessions, and management is change and senior. Okay. And if he or she gives you a problem, like he was dating me, he was instant form. Yeah, instant form. And you're gonna escalate anyway. So escalation is there, yes or no. Escalation is, a senior is there. changing counselor is there, but if she gives you or he gives you a dodgy thing, so then incident form. Clear? But what if she doesn't want to open and Dr. Rami Fadl tried his best to? Do I have to open? No.
Just internet for the suicide.
That's it. I don't have to open, guys. Guys, please, I do not have to open. I do not have to open, guys. You think you have here misconception about if the patient is not opening, I will fail. No. I will give just a small quick example. You know the paracetamol level procedure. You all attend the procedure, yeah? The paracetamol level. The patient was suicidal, and when you go, you want to talk to her about what did you take, how much did you take, and you know, and is there any psychiatric history in this scenario? In this case of the procedure, no psychiatric history, but she might not even open for you. So you can proceed with the procedure without her opening. Yes, because some situation she doesn't open. I took paracetamol and that's it. She doesn't want to tell you anything else. So you tried confidentiality, everything. She doesn't open. Do the procedure because it's an E situation, and they ask you to do procedure. Take paracetamol level. The patient is not opening. That will not change anything in your. You're gonna take paracetamol level anyway. You understand? Because you get stuck and you spend your time trying her to open and she's not opening and you're not gonna take the blood and she's gonna die. You understand? So okay. Next station.
Excuse me, Assalamu alaikum.
Alaikum assalam. Doctor, how are you? I prefer no questions till the end.
Yes,
because,
please, Dr. Mo, this is related to this question, what we were doing, because we have no idea that you said that the patient is on the GP setting and the patient came to change the counselor. So anyone can change the GP or anything, but so please guide that the counselors are sitting on the GP setting. I mean, and the
Doctor,
GPs are how the GP
that's very irrelevant. You are overthinking stuff. If I need to do something, I can do through my GP. My GP is the family doctor.
Okay.
So regardless where I'm going, you are the doctor talking to her.
Okay. So
don't over. Can I go there to the question said you are in the GP, talk to her. She wants to change. Even if the question said you are in theater. I don't care really. I will go with this. I'm here. I am the FY2.
Yes.
So please don't overthink in PLAF 2. You know, you are in the GP clinic now. Can someone come to you to discuss counsel in the GP? If he told you are in theater, you are going to be the theater. I am the FY2, and the task is?
Yes.
The task is discuss what? Discuss the change of counsel. And that's it. So regardless, but yes, he will go to the GP because the GP is the family doctor. Is what?
Okay.
The family, he's the family. Guys, they call it family doctor because he knows you. When you go there, it's a clinic by the area. Where you go to the GP, it's people do know you. But anyway, let's move the questions. I've given the session. I'm sure that there is no questions here.
Yeah, please, one more
question. I don't want to be rude.
You know,
I don't want to be rude, but I've prepared for you many stations.
Yeah.
I don't want to stay here for 5 hours. I want to just 2-3 hours to finish our station.
Yeah. Only one question why I'm asking, because I have to refer him to psychiatry, so that, or what should I say, that I will make an appointment for you to a new counselor?
You don't need to say anything. Say it yourself. You're going to have to go back to your psychiatrist again. Or as you told me, told me that you are going back again to where you were, and you already explored what she means by where you were. So I think counseling at this stage might not be enough. So send the psychiatrist. Guys, don't be so like, how can I say it? Psychiatrist. You don't need to overthink and be sophisticated. And let's end the questions, please. Doctor, let's end the questions because I've got plenty of difficult situations. And if I allow you, I will allow everyone else.
Yeah.
And then we're not going to end it.
Yeah, I'm sorry. Just I will say that I will make an appointment with the new counselor, or I will refer you to the psychiatry, and your psychiatrist will change the counselor. My question is only
counselor
this.
right away. Counselor right away. You're going to change. And also, this patient might need medication, might need,
Okay.
So, yeah, he will need psychiatrist. Okay?
Okay. Thank you. Thank you. Thank you very much.
Jazakallah khair. Guys, can we stop the questions?
Yes.
Wallahi, for your own sake. Allah, I don't care. I don't care. But whatever I give you, I think that's what we need. And if one person asked, I will give the right for everyone to ask. I hope you don't think I'm annoying by saying no questions. But if I spend on a station 2 hours, I don't care. خلاص, change of cars, let's go home. But if I do many stations in 2 hours, and then you can ask your concerns on the WhatsApp group, I'm gonna answer. Don't worry. Okay, I'm gonna answer on the WhatsApp group if you say, this station, what happened today, Next station. And please don't overthink in flat 2, guys. Can he come in the GB? If he comes to me anywhere, I will seriously, I will talk about it, and I will. Yeah, okay. So just be simple. Yeah. The next station, I hope they're not upset when I say no questions. But you remember when we were opening the question, the first old course?
Yes.
Every station is like 10 hours. Okay, the next question is, the next station is, anybody from the doctor, anybody wants to come? Anybody wants to come? Or should I pick one from them? Okay,
Yeah.
okay. By the way, online doctors, the academy doctors are shy. They just don't wanna come,
We
which is giving you the
participate
chance.
as well.
Sorry?
We want to participate as well.
You see? You are only participating. Only you participating. Dr. Hira. Dr. Hira. Any change of counselor scenario, please, would you be able to manage it?
Yes.
With an open mind or with a closed mind? Open mind, okay? So, Dr. Hira, one thing, do not show at any stage that there is a relationship, unless the patient says, okay? Because I fell on this trap that in my exam, I just like, anything happened? No. Seriously. Till the level that I said, did he ask you out? Anyway, I was so scripted. Anyway, Dr. Hira. Dr. Hira. I have to be honest, I was so scripted. By the way, guys, I've done my PLAB 2 twice. I did not pass from my first attempt. I passed the second time, yeah? So when I was preparing for PLAB 2, the first time, if I would have passed in the first time, I would not make a course. I would not give courses. Wallahi, I would just pass like everyone else. Passing the score is 100 and I get 101. Thank you, move on. But the first time, I read my notes really well. I have read my notes 10 times, plenty of times. I finished my notes. Wallah, if you ask me, where is that thing? I will tell you the page, flip the page on the right-hand side. I was that much knowing the notes. And I got a score in the first attempt. When I was going to the exam, I was very confident. I said to myself, I'll pass all the stations. I studied for 6 months, brother, reading all the time, 10 hours a day studying. And then I read so much, I knew the stuff properly. I knew the script as A to Z. And I got a score that I've not seen it yet. I've not seen it yet till now, since I started teaching PLAB 2. Seriously. Till now, I have not seen my score, the first attempt. I've not seen. I did not come across that score. So I'm telling you to be no, seriously. I'm telling you to give you the confidence. Yeah, don't worry. Doctors who did not make it the first time, it's fine. Many doctors don't. Okay, carry on, practice, study. It doesn't mean that you did not make it that you are bad. Maybe you're doing something wrong. So learn. The second attempt, I doubled my score. So you can check. Yeah, the second attempt I got 160, 168. So it was like very high score at this time, and all my stations 10, 11, 12. The station 10, 11, 9, 10, 11, 12. But my point is, that's why I started teaching, because I was going the wrong way, very wrong reading. And that's why I always say no script. Don't, because I was dealing with my patient. Every patient is that kind of script I studied. Okay, and when I came out of the exam, the second attempt, people, they write down, that these are the scenarios. What I found in the cubicle, half of the stations were different from what people wrote. Wallahi, different. People wrote this different. Mine was different. Why? Because I was using active listening. I was listening. I was following the patient, and then when I came the second attempt, The first attempt, I said to myself, after the exam, full mark after the exam. Wallahi, I done the exam, and then when people ask me, lab 2 is very easy, man. I will pass 18 stations. The question exactly, I went to change counselor, and change counselor, like, you're excited. But then when you start active listening, then you doubt yourself. So the second attempt, I doubted myself. I said it was before I was okay, before I knew what's happening. This attempt, it's not the same as what I read. No, everybody's different. And that's when I passed the high school. Let's move on. Mute the mic, please, Dr. Hira. Let's start.
Yes, sir. Actually, I don't know how to ask any question.
You don't know how to ask any questions?
How to start it, because this is my first or third day to.
Okay, we'll choose someone else. Don't worry. We'll choose someone else. Don't worry. It's fine. Dr. Fairuz. Okay, Dr. Fawziya Khan. Dr. Fawziya Khan.
Hello. Yes, sir.
Okay, you seem you have noise next to you, right?
I'm just going upstairs.
All right. Okay. Dr. Fawziya, let's start. Write down, guys.
Yes.
You are an FY2 doctor?
Yes.
You are an FY2 doctor in the GP clinic.
Okay.
Isabella, 36 years old.
Okay.
Has 3 daughters. 3 daughters.
Mm-hmm.
The 3 daughters, 8, 10, 12 years old.
Right.
She comes to you today because she has a concern.
Okay.
Dr. Falakans Salim, your camera's on. Quickly, switch off. Quickly. Okay. There's nothing here. But quickly, nothing. Just a camera. But I have to. Okay, let's start.
Yes, sir.
Yes, and this station as well. You have seen it, the one that we're gonna discuss now.
Okay.
But again,
Can you please repeat the scenario, please? Can you please repeat the scenario again?
Sorry?
Can you please repeat?
Yeah, the scenario is
again,
Isabella, 36 years old. عندها 3 عيال. She has 3 kids, 3 daughters. Okay, and that's it. And the daughters, 8, 10, 12 years old. That's it. So Isabella with 3 kids.
Thank you, sir.
This is the question, yeah? She's coming with a concern. Okay, let's start.
Okay, sir. Hello.
Hello?
I'm Dr. Khan, one of the doctor working in the GP department. Can I please confirm your name and address? Name and date of birth?
My name is Isabella. I'm 36 years old.
Okay. Isabella, I can see from my notes that you have come here with a concern. Can I please ask you, how can I help you today?
Well, I want a baby boy.
Okay. Why? Okay. Well, I can see from my notes that you have 3 daughters, right? Age 8, 10, and 12.
Yeah.
Yeah. So, how long have you been trying for a baby boy?
Since I go with my partner. So these 3 daughters were supposed to be boys. So but we kept trying, and the time it's a girl.
Okay. Right. So, how long have you been with your partner?
I've been with my partner for about 14 years now.
Right. And when did this concern actually started? Like since you are with your partner,
Since
or
since we decided to have kids, my
all
partner
right?
always, the concern is a boy, baby boy, to carry the family, to carry his family name.
Yeah, sure. I can understand because in some families and in some culture, uh, there is a myth. Yeah. Okay.
Yeah.
So,
What culture? Which cultures, doctor?
in some cultures, it's a big thing to have baby boys.
Oh,
So,
like which cultures? Can you give me examples?
so many
I thought
Indian,
only.
Pakistanis,
Okay,
Chinese.
Pakistani,
Yeah,
Chinese. Okay, all right.
yeah. So don't worry about that concern. Um, I'm just, I'll just try to help you out.
Yeah, I thought it's
So,
only my husband. So it's Indian as well and Pakistani. And what about Egyptian? Is it the same?
maybe I don't know about, but I do know about these three cultures.
All right.
Yeah,
Okay.
yeah, yeah.
So now I need
Okay,
a baby boy, doctor.
okay. So, uh, is it like your wish as well, or is it a forceful wish by your partner?
Uh, it's my partner's wish, but I want my partner to be happy.
Okay, right. That is a valid concern and wish, and you are just trying to like make it work. Um, so have you tried anything, any artificial method or any method that could help you out?
Can you tell me, doctors, are there method that can help me out? Because I don't know. What method can you think it can help?
Well, there are, but before like telling you those methods, I need to ask you some questions if that's all right
No,
with you.
please. No, please. Tell me the methods first. I've been trying
Okay.
for
Mhm.
14 years, and I think the methods for me are more important than the history.
Have you searched out on your own as well on internet or maybe some knowledge or something for
No,
friends and family?
you give me the ways that you said that it can help in having baby boy, and then we can later discuss what I searched and everything. Yeah, what can help, doctor?
Well, first of all, ac- if I need to ask you first, like your all the three pregnancies history, your uh, because it all depends on if you have normal pregnancies or you had
All right.
cesarean or
Okay.
what what those
No, no.
pregnancies planned.
I had healthy daughters,
Mm-hmm,
normal pregnancy,
mm-hmm,
delivery, no problem.
mm-hmm,
Everything was
mm-hmm.
fine. So, but
Did
what
you
are the
try
methods?
and those pregnancies were uh, just like you didn't try for them. Uh, they just happened naturally. That's right?
No, I did try to. No, I did try for this. I wanted kids,
Mm-hmm,
but I wanted boys.
mm-hmm, right. Okay. Um, well, there is a method called in what it is called. It is called
Implantation static. Yeah,
it is called uh, pre
yeah.
uh,
Pre-implantation.
pre-implantation. Yeah.
Yeah. Okay. Very good method, doctor. Can you refer me for this method, please?
Well, let me tell you one thing that this hasn't been covered by the NHS, unfortunately.
It's not. Sorry. What?
It's not covered by NHS,
Okay. I
unfortunately.
can go private, doctor.
Okay.
I have
Okay.
money to go private. Yeah. Fine.
Okay.
Okay.
Right. So we could just um, refer you
Two
to a
minutes remaining.
specialist.
Give her three,
And
doctor. You have 3 minutes. Yes. You can refer me where for this. Yeah.
yeah, I can refer you to a gynecologist specialist,
Perfect. Okay.
right? They will just take out your examination, your partner as well, and just
Okay.
to make sure you are like eligible for this method or not.
Perfect. Okay.
Okay.
Thank you very
Okay.
much. You are very helpful. I mean,
Any other questions you have today?
I want to make a complaint
Sure.
because I've been having this query for a while and nobody was helping me, but only you helped me. So I just want to make a complaint about why didn't they were very helpful as well. Nobody was helpful. You are the most helpful doctor ever. Thank you very much.
Okay.
Okay, she's not.
I appreciate that. I
She doesn't
appreciate
say
that.
okay. That's comment. Yeah.
Any other thing? Any other questions you want to ask today? Because I'm short of words. What is it?
No other concerns. You addressed my concern, my main concern. I'm really happy with you.
Okay. Thank you.
Thank you very much. So good job I choose these stations. Good job, very good job. I've actually chosen difficult stations that people like are lost and and they are common. Did you see this one? No.
No, seriously no.
But okay, good that you've seen it now.
Yes.
Okay. So the doctor, what's your name? Fawzia. Fawzia, yeah. What's the name? Fawzia. Yes, Dr. Fawzia. I will give her 000. Okay. And again, regardless what I give her, how would she improve? How would she do it good next time? Okay, so I would give her 000. Dr. Fawzia, she did a massive mistake mentioning culture and mentioning the Pakistani and the Indian and the Chinese. Dr. Fawzia, if it was for me, for this mistake, good job she made it. Good job she did it. So she knows now. I would fill her the whole 16 stations that she will go for. Like psychologically, I would not pass you the whole. I'll say to you, listen, I'll call the other examiner, fill this doctor, guys, you don't use cultures, you don't use religion, you don't use the word God in PLAB 2. Again, you don't use the word God. You don't use the word, guys. Some people, they take videos of me and it's so silly, so silly. When I teach you PLAB 2, I'm teaching you PLAB 2, regardless. Okay. So some doctors, they take videos and they think they are funny, and then they send me the videos on private and they say, Dr. Mo, why you talking about LGBT? Why you talking about, this is not, you are not a nice person. I've received plenty of comments like this. When I give you the LGBT, people comment, why you are teaching us LGBT? Why you are teaching? That's not nice. So whatever I say, I'm teaching you PLAB 2 and I'm teaching you, how we do in UK, and I'm teaching you the things regardless. So in PLAB 2, don't mention God. Don't mention, okay, God, inshallah, God, people do mention God, okay? Don't mention religion. Don't mention culture. Are you clear?
Yes.
What she did was very wrong. Saying, don't worry, cultures in Pakistan and India and all the same, don't worry. Okay. So that's one thing. That's a main focus for me. Avoid it. Because it's very wrong. I will fail you once you said it. 000, halas, regardless of what you said. Okay. Now, this is a station about a lady who wants to have a baby boy. Okay? To have what? Baby boy. That's the start. How can I help you? It's a female doctor coming to me. Mo, I want a baby boy. I want what? And this is the first phrase that will come out of her mouth. Okay. If I am coming to you, doctor, what's your name? Dr. Wasim. If I'm coming to you, Dr. Wasim, a female Isabella, and how can I help you? I want a baby boy. What is your first response? No. 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 What do you mean you want a baby boy? And how can I help? Maybe she won't have sex with you. I want a baby boy, Wasim. Wasim, I want a boy. I want a baby boy. Do you want a baby from me? Do you want a baby boy? What? Guys, be logic. Be natural. A patient is coming to me, I want a baby boy. What can I do for you? That's the reaction. You understand? So that's how you're gonna start. That's how you're gonna initiate it. So can you please tell me, what do you mean by you want a boy? And how can I help you with that? What? You want a boy? What's that do? That's the kind of approach. What do you mean you want that? And how can I help you with that? Because you don't know. Don't approach it right away. You know why? Why? Because I want a boy. Any mother will want a boy or a girl, and do you understand me? No. So what do you mean you want a boy, and how can I help you with that? Then she will start opening for you, doctor. I've been having 3 daughters. Guys, understand the station. I've been having what? 3 daughters, and I just want to be a boy. Okay. When she tells you 3 daughters, I'm gonna use this in my station as a part of rapport. Did she ask anything about daughters?
No.
So the 3 daughters, number 1, that means that, oh, I want a boy. I'm only having daughters, kids, and use it as a part of rapport. Oh, that's lovely. How are they? How are they doing? How old are they? Okay, 11 and 12. Are they doing good? Are they doing well? As a part of rapport, 20 seconds, 10 seconds. So tell yourself, whenever she mentioned daughters, yeah, imagine if I'm sitting with you and say, oh, so yeah, I have 2 kids. Oh, really? No, natural. Forget about plan. Oh, what's their names? Alicia and Tony. Oh, how are they? How old are they? Understand, guys? Rapport. That's your patient. Rapport. Whenever she mentioned 3 daughters. Okay. Then, but rapport not half an hour. Rapport just like, oh, it's no smile and say, oh, that's lovely. So how old are they? Okay, they are 11 and 10. And how are they doing? Are they doing good? Are they doing okay? And then move on to your topic, which is, doctor, I want a baby boy. Is that your wish? What you want? She will tell you, no, it's my partner. So now, as a superficial doctor, what are you going to be thinking of in the Egyptian accent? What are you going to be thinking of? So I'm going to be thinking of what? Could it be NAI?
Yes.
Could it be that he's abused? He actually, guys, there is something called mental abuse. So abuse is not just physical.
Yes.
Abuse could be mental. I'm forcing you. I want boys. And if you don't, I will divorce you. I'll get another wife. Things like this. Abuse. Which I had this story, but she did not explore it. I was gonna tell her my husband is from Egypt, and he told me that I want he want boys, and his family want boys. If I don't give him boys, he will divorce me. That was my story, but she did not. That's why when you come out of your exam, lab 2 exam, people give you stories and you didn't hear, you didn't know. That means that you did not ask. Okay, so is that what you want? I told her, no, it's my husband. Yeah. She should have explored. What do you mean that your husband, I mean, does he force you to have boys? You need to explore any kind of force here your own way. Okay, so NAI must be excluded. Okay, is there any force? Okay, is there any threat that if you don't have boys, what's going to happen? You understand? Things like this. Because it could be a change of counseling station there. Nobody can force you and this and that, yeah? Anyway, guys, are you following the breakdown of the station? So because I cannot give a question answer as people question answer, I just like to make it as discussion of the station. And then so number 1, that what do you mean by the boy and how can I help you? Then go for the daughters. I have 3 daughters, rapport with the daughters, natural conversation. Then go for, is that your wish or no, to my partner? Okay, and I mean, if you can't have a boy, what's going to happen? I mean, is there any threat? Is there any, how do you get along with your partner? How's everything at home? Is everything all right? Which is a part of, again, you want to see the relationship. Is there abuse there? NAI? What's going on? Okay. And you need to ask about her mood. Why? She must be low. She must be something. Again, there's something going on, guys, for her to come. She has 3 daughters and she needs a boy. And please help me. I need a boy. I have to have a boy. Mood. Okay, so mood NAI, and then some history about the previous kids that she had, the 3 daughters. Yeah, are they healthy? But not bear the triple D. No. But 2 seconds. Are they healthy, fit and well? Any healthy issues? Yeah. And you should ask any problems in pregnancy or any problem with pregnancy, to do with the pregnancy and healthy issues in your family or your partner's family. Why do I ask this question? As one of question, just to establish the healthy issues in your family side or in your partner side. Because you need to make sure that there is nothing inherited. Because the technique that we're going to talk about, the pre-implantation genetic diagnosis, something I'm going to discuss now, they offer in countries, if kids gonna be sick, if there is something inherited, if the kids will be Down syndrome, something like this, they can offer things, but not in a normal situation. So she will be normal, everything, but you need to show them that I know what I'm thinking about. I wanna assess, is there anything that runs in the family, basically, from your side or partner side? Any healthy issues that runs in both sides, your side and the partner side? She will say no. It's just a case of I want a baby boy. Okay? So avoid the culture, avoid the religion, avoid, yeah, happens in Egypt as well, don't worry, avoid these things. That's not rapport, that's not nothing. So now, so far, we have discussed a few points in your history. You have said, take history about the quick history, 20-second kind of the kids. Are they doing good? Are they all right? Any healthy issues? No. Then quick, your partner and your side of the family, any healthy issues, any medical issues that runs in the family, which I'm talking about inherited things. No. Okay. Now, why do you want a baby boy? You want to know the background. You want to execute NAI, mood, because it could be a cause. And after you establish everything, then she will start asking you some questions. Doctor, is there any alternative methods? So she will ask you, guys, you don't tell her any alternative. There is no. Is there any ways, doctor, that I can have baby boy? Is there any ways, guys? No. No. There is no ways that she can have a way that you can do for her to have a baby boy. Any non-medical alternative methods. Why do you say that? Because some patient, and this patient will be the same case, will tell you, doctor, any sexual positions that I can have baby boy? But yeah, it isn't a concern. I'm not just saying it to laugh and no. It is a concern. It is some people think sexual positions, certain sexual positions, certain food, certain time of ovulation, can get you a baby boy. No. Is there? No. There is no way. So that is your answer. Yes, some people do think that there are some methods. However, that's not proven. And no. Okay, that's your answer. But she was saying to me, there are methods, there are something you can do. Okay, now she will tell you, doctor, I've heard about, guys, do not bring the pre-implantation genetic diagnosis. That is a method of having a gender. You don't bring it because it's banned in UK. It is what? They don't do it. It's a method that it's not done here in UK. So why did she bring it? Only bring it. She read it because I read it in the same place. Yes, don't bring it. It's written in the notes. It is written in the no pre-implantation genetic diagnosis. No, you don't offer something that's not gonna be done. You understand me? Yes, it's been done. Doctor, that I like it, but it's not. It's banned in UK. Why do you bring it if it's abandoned? So do not bring it unless she tells you, I heard about a method called the pre-implant. You say to her, yes, that's right. It's done in some countries. However, it's illegal in UK. You understand? But you don't bring something just because you read it and it's not the patient main concern and the patient haven't heard about it, because that can bring ideas and tell you, which countries, doctor? I want to go there. I have money. I can go and do it. It can bring, and then You stop. So there is something called pre-implantation and things that, yes, they can, the gender, and but that's not here in UK. So don't go there unless she tells you. And your answer will be, okay, they do it in certain circumstances. If there's inherited family problem, if there is, and in some countries, it's not here in UK. But do you understand what I mean by don't mention something you're not gonna do? Yeah. Don't. Okay. Now, she will have some other concerns. She will say to you, doctor, can I have, can I get pregnant and then abort? To go through abortion if it's not a boy? That's a concern. No. Can I? Abort if it's not. Yes. Can I get pregnant and have an abortion if it's not a boy? Well, in UK, we don't do abortion on the understanding of gender selection. We don't. It's illegal on the understanding of. So abortion is legal, but not for gender selection. Not if I will be pregnant, and then if it's not a boy, I will abort. That's not a reason. In UK, you tell her it's not done for that reason. Abortion, we don't do it for gender selection. Only is done, number one, before 24 weeks. So it cannot be done after. And if the termination of pregnancy is needed, as it will affect the mental or the physical or the psychological state of the mother. You understand me? So in UK, can you abort after 24 weeks? No, that's out of order. You understand me, guys? I'm giving you the rule. You cannot abort after. Okay, before 24 weeks, can you abort? Yes, we can. But if she wants a baby boy, can you abort? If the continuation of this pregnancy will lead to psychological, mental, physical, healthy issues to the mother, yes, I can abort. Gender selection, no. Guys, I'm giving you the thing so you can answer your own way. You know now. Then answer her. Online doctors, are you lost? So this is how the case will go. So if she tells you, is there any alternative things? Is there any alternative ways to get a baby boy? No. If she tells you, doctor, I will abort, I will have a baby boy, it's a concern she will have. Guys, all what I'm talking about are concerns. So I'm giving you the answer for them. Doctor, can I get pregnant? And if it's a boy, abort? What is your answer? Well, abortion in UK is unlawful, which against the law. Okay, if the mother or the father, they want it, depending on the gender selection. It's only if it will affect the mother's mental, physical health issues, but not for this cause. Okay, and the abortion is also before or after 24 weeks? Before, yeah. If she tells you, doctor, I heard about sexual positions. Doggy style can get me the baby boy. What is your answer? No. Doctor, I heard that there is certain food that if I can have, then by the way, it's all questions in these stations. I'm giving you I'm not making up concerns. She will tell you, doctor, I heard that certain food, spicy food, can cause me to have a baby boy. Is it? No. Doctor, is there any way I can have baby boy? No. Okay. When she tells you the pre-implantation, then you say to her, it's not done in UK. It's not. Do not mention something just because it's written and it's just, no, don't bring it. Okay. Now, another concern. Online doctors, is everything all right so far?
Yes,
Some
doctor.
doctors
Yes.
rules in Arabia and the rules in India and in Egypt, Yeah. So one more concern, doctor. You know, I heard that there are certain scans, we can do to know the gender of the baby. Yes. And if it's a boy, I will abort. If it's a boy, I will abort. So there are two things here. She's talking about two words. What are the words? Scans and abortion. So you will say to her, yes, that's right. We do scan. There are scans. There is a scan that is done at 8 weeks, which we call it dating scan. Dating to know the date of the pregnancy. And there is a scan done 11 to 14 weeks, which to check if there's any anomalies like Down syndrome. And there's a scan that's done 18 to 21 weeks for the gender. However, is it 100% correct? No. It's not 100% correct. That's one thing. And again, I'm really sorry to come across that way, that abortion for that reason is not lawful in UK. It's against the law. Okay. So can you recap? And the station now, doctor, what do you tell her? You know, if it's abuse, go for that. And I say nobody should have the right to force you. Have you spoken to anyone? If it's abuse, if there's no abuse, there's nothing, but she just wants a baby boy, then go down that road. Say to her, well, there is nothing we can do. I'm sorry, nothing we can help you with, but you can think of adoption. Yeah. If she's going down the other road of my husband is forcing me and threatening me, and again psychiatry, bullying, abuse, kind of low mood, and you know that shouldn't have happened, and you understand. So a station could be whatever, and you will explore as I gave you. Whatever, go there. What do you mean by baby boy? How can I help you with the rapport, the 3 daughters? Ask about inherited family issues, inherit her family. No, there is nothing. Address her concern. If she's asking about the scans, if she's talking about the abortion, so, and then adoption, and you cannot really help her with having a baby boy. What if she tells you, my husband thinks that it's me who can decide the gender of the baby, it's depending on the mother? How can you answer this? Sorry? No, I'm saying, is it here that no? So you can say to her, no, this is not true. Okay. And you can offer, if there is an issue, to bring the husband if she agrees. If she agrees for counseling. I've done this station, one of the doctors, 2019, because I remember this incident because it was very funny incident. So I remember this because it was the funniest thing that I've ever heard ever in Plato. I said to her, it was similar to what the doctor said, but the doctor was talking naturally, not in a funny way. The doctor, when she said Pakistan and India, but this doctor was so funny. I said to her, well, I want a baby boy. Why? Because my partner is from Egypt, and he told me that if I don't have a baby boy, by the way, she passed and she's working as a GP. If I have a baby boy, if I don't, he will divorce me and he will, he's threatening me. What did she say to me? She wants to make me happy, but I'm her patient. Let me tell you something. Wallahi, that's what she said. Wallahi, that's what she said. If your husband told you that he will leave you because you're not having a baby boy, it's just an excuse. He knows another woman. Wallah al-azim. Wallahi. He knows another woman. That's what men do. He just created an excuse. Even if you have a baby boy, he will still. He just created an excuse to have another woman. Seriously, that's what she told me. I'm from Egypt. Egyptians do so. Thank you. But she was not joking. She told me, I wanna make her feel comfortable. I wanna make her. I said to her, no, comfortable is just like, this is what men do, and this is, So that's not rapport, yeah. That's miss rapport. Next station. Sorry,
Just I asking if a woman wants a baby boy, what is it?
What?
Women want a baby boy. Is there any issue with that?
It's fine to want a boy, but as long as she want, he want, no force. You understand? It's fine. A mother could have 3 daughters, guys. A mother could have 3 daughters, and she really want a boy. She really want a boy. No abuse, nothing. Is it normal? Yes. But can you do anything about it? No. That's it. I understand. You cannot do anything about it. You cannot help her, but make sure you explore that, you know. But no, and I'm telling them no questions, and so you understand. So sorry, I'm here. I'm gonna finish. Anybody wants to come from the Academy Doctors? Guys, are you benefiting from these stations? Yes. It's all difficult, challenging stations. So anyone wants to come? Yeah, brother. Come here, brother. Come. He's the brave of the Academy. He's the brave guy. Yes. Gonna come forward? A bit forward. Yes, so we need to. Okay. What's your name?
My name is Siddhan.
Siddhan. Where are you from?
Nepal.
Nepal. Okay. Is that old Mount Everest? Yeah.
Yeah.
Have you been there?
Mount Everest? No.
No. Same as me. I have not been to the pyramids. We have the pyramids in Egypt. Wallahi, we have lots of, we have cities where the mountain, the monuments and stuff. I've never been there. Never seen anything there in Egypt. Yeah. NAI abuse. I was abused when I was young. Anyway.
Was it real or what?
Right, the question. Look, consultant. Look, guys. No, sit back. Look, sitting like a consultant. Look, consultant. Cross legs. Don't worry. I'm just like.
No, I'll be like.
No, be comfortable. You know, consultant kind of. Okay. You are an F2 doctor in the acute medicine department. Salma Hayek. Have you heard about her?
Salma Hayek? I can't remember that one.
She's known. Salma Hayek. She's okay. Is the mother of 19-month-old Ahmed Hayek. Hayek, surname, same surname, yeah. Okay. Who was 19 months, yeah, previously diagnosed with neuroblastoma, but he's in the hospital treated for sepsis. The nurse has noticed that the child is given, okay, not green liquid, yellow liquid. He's saying green liquid. He's saying green liquid. No, yellow liquid. That's that. You see, that's not a green liquid. You know, if in the exam we change it to like herbal medicine, new station doc, herbal, green, blue, yellow, anything, something, and that is not prescribed in the hospital. Talk to the mother and address your concerns. So you've been asked to speak to the mother about it. So don't be scripted. If I tell you green liquid, yellow liquid, black liquid, herbal medicine, unknown thing, please, it's all the same. Okay. So 8 minutes, guys. Did you understand the question now? Yeah. The question.
Sorry, Dr. Muhammad, can you please repeat the scenario again?
Okay. The question. Salma Hayek is the mother of Ahmed Hayek. Ahmed Hayek is 19-month-old. The baby, 19 months. He is admitted in the hospital for sepsis. He is previously, past history, he has neuroblastoma. The nurse has noticed that not his mother, he gets given yellow liquid. That is not actually in his prescription. Talk to the mother, address her concerns. When you're ready, I'm ready. Is the question clear, guys?
Yes, sir. Question is clear.
Okay.
Yes, Dr. Mo, the question is clear.
Guys, have you heard this station before?
Yes.
Common?
Yeah.
Difficult or easy? Everybody keeps failing. We will know now. I'm sure, you see, whenever any of the doctors approach the station online or here, you can spot this is what you do in the exam. This is what people, that's why people fail. That's it. It's simple. So that's what we do. And if any one of you come here to the station, again, under pressure, you are not the same. Trust me. Sometimes I tell one of the doctors, doctor, I want this. And he doesn't ask me why. And everybody's shocked. You should ask why. Yeah. But if you are here, you will forget. That's why be simple, please. Don't try to make things sophisticated. And fair enough, it is sophisticated. Fair enough, it is difficult. Fair enough, it's stressful. Okay? Let's start.
Hello.
8 minutes, Dr. Amar Sobhy.
I'm here. I'm ready. Time starts now.
Habib.
Hello, my name is Siddhant, one of the doctors in this department.
Hello, Dr. Siddhant.
May I confirm your name and age, please?
My name is Salma Haik, and I am 29 years old.
Yeah. So I can see that you are here for Ahmed Haik.
Ahmed Haik, yes.
Can you please confirm his age for me?
He's 19 months old.
19 months old. So can you please tell me how is he doing and everything like that?
Yeah, he's in the hospital, and everything is okay.
Can you please tell me? Can you please tell me why is he in the hospital in the first place?
He's in the hospital for some infection.
And how is he doing now?
Yeah, he's getting better slowly, but okay.
That's really reassuring.
Yeah.
Also, can you please tell me, is he suffering from any fever, flu-like symptoms at this present time?
At this time, is when I brought him, he was having fever and he was really sick, but everything is going, okay.
Better.
Yeah.
Did he complain of anything else, like?
No, he did not complain because he's 19 months old.
Yeah.
Yeah.
Yeah. And have you noticed any, like, when you lift him up, do you notice like he has pain in his neck or anything like that?
He when I leave him up, he doesn't complain of pain. He's 19 months old.
No, like, does he cry?
He's crying all the time.
And I have a blank. So yeah. So anything else you'd like to tell me?
No.
Is it by chance diagnosed with any medical conditions?
Yeah, it's a condition called the neuro plus something. Blastoma, this one, yes.
And how is it doing now?
Yeah, I mean, it's tough for us to just to go through this, but yeah.
And is he following up with the doctors and anything?
Yeah.
Any particular condition that he's going through the medications or anything like that?
No, that's all. That's what I have. Yeah.
And how about diagnosed with any other medical conditions besides neuroblastoma?
No, that's enough. No, nothing else.
Is there any medicine that he's going on with?
Medicine? No, he's taking his antibiotics. They're giving him antibiotics. They're giving him fluids, and yeah.
Anything else besides the antibiotics and the fluid, if you have noticed?
I don't know. They give him, what they prescribe. I don't know.
And is he allergic to any medicine?
No.
And how about any family history that runs through the family that you could tell me today?
Family history?
Yeah.
Yeah, there is. Yeah. My mom, she's got brain tumor and diabetes and kidney problem and high blood pressure.
I'm really sorry to hear about that.
Yeah, and my dad, do you know about her condition? She's doing. My dad is having heart failure, and he had a heart attack 6 months back, and he's having a kidney problem as well, and he's having some diabetes as well. And my sister, she's having polycystic ovary, and she's having
Sir, video is
problem.
paused. I'm sorry, we cannot see your video. I'm sorry to interrupt.
And that's from my family side. From my partner family side, yeah, some more issues.
Okay. Thank you so much for answering these questions.
Yeah.
And how are they coping up?
They are coping. Well, my mom, she's on medication for diabetes and blood pressure, and she's at home with my dad. They look after each other, and they have carers as well with them. And my sister, she's married and she's got kids as well. Yeah, and she's doing well. She had an argument with her partner 6 months back, but we're fine now.
Okay.
Good, carry on.
You got me blank.
No. I'm just answering what you're asking.
No, I was like, any family condition that runs like situation.
I'm telling you what runs. Yeah. You're asking me, and what runs in the family?
How is his diet and
his diet?
Yeah.
He eats healthy. He eats fruit and veg. I know. How's his diet?
Yeah,
he's fine. He eats. He takes the fluid. Yeah. I give him everything. I give him everything he needs, and milk, everything.
Besides this, have you given him any supplements and things like that?
Supplements? I give him some herbal medication.
Herbal medication.
Yeah.
Can you please tell me more about it? Like what it is?
It is a yellow liquid. That's over the counter. It's very good. It's improving him very well. He's doing way better than your medications. Yeah.
And
it's like vitamins.
Okay, so you told me over the counter. So did you get it from the pharmacies?
No. It was not prescribed. No.
Can you please tell me where did you get it from?
Where?
Yeah.
Over the counter.
How did you get it? Like
how?
From anyone else?
From over the counter.
So from the pharmacy, you mean?
Yeah, from the pharmacy in the big store, Asda.
Okay. And I'm really happy. I'm really glad that he's getting better.
He's very improving a lot. Yeah.
And do you have any idea what is the content of that herbal medications?
They said, like herbs and natural remedies and stuff. Yeah.
And do you have any idea what's the content in that exactly?
Vitamins.
And what are the vitamins?
2 minutes remaining.
What are there like?
What are the vitamins?
What are the things?
Vitamin A, vitamin B, vitamin C, and omega-3, and some other constituents like Yeah.
And anything else you'd like to tell me by any chance?
No.
Anything else you are giving him?
No. Just vitamins and that's it.
So I would like to do some examinations on him.
Okay.
And come back to you. How is it going on? I'll be doing the general physical examination specifically to check the whole body. How is it, the body and everything. Along with that, I'll be checking the chest examinations, abdomen examinations, the belly examinations, eyes, ear examinations.
Okay. And, so eye and ear and everything.
Yeah.
Okay.
And check how is it going on.
Okay.
Any findings? Yeah. No finding? I should continue. Okay. So we have done the examinations. So Salma. So Salma. So you told me that you are giving her the herbal medications, and I'm very glad that the baby is getting better, but we really don't know what are the constituents of the herbal medications.
Okay.
So it would be very hard to say that what exactly has causing the baby in getting the baby better. It may be because of the certain medications what we are providing, or it may be because of the herbal medications. We really don't know at this present time.
Okay.
And what we will be doing at this present
time is up.
One more minute.
So what we will be doing at this present time is we usually what we do is we keep the medications which is really authenticated and all those things.
Okay.
From our government and the medicine. And since the herbal medications, we really don't know what are the constituents.
Okay.
Will it be alright if I stop the medications?
You're gonna stop it?
Yeah.
Okay.
And we'll send the medicine to the lab to see what are the constituents and everything. And get to know.
Okay. You're gonna send it to the lab.
To the lab.
So they check and they do the their own check, and they check what's the contents
What's
of
the content, and there may be reactions
Love.
because of the
very caring hospital. Okay, you're gonna send it to the lab to check,
send it to the
to whatever,
to
be checked.
yeah.
I don't care about where. Don't worry,
Yeah.
that's not the trick. It's gonna be sent.
Yeah.
It's gonna be sent to be checked, the content and stuff.
Content, because
Very good caring
yeah.
hospital.
So I'm wrong here already.
No. Caring of the hospital will take the liquid that I give myself, my son, yeah, to be checked. Caring. I think it's caring. Very good.
It could be okay. So basically, what happens is like the oral medications may have the interactions with the medicine what we are giving. To check further for that, what we will be doing is like we'll be doing further blood investigations, like liver examinations, the kidney examinations, and basically general examinations.
Okay.
And also, I'll talk to my seniors if we need to do any further investigations or not.
Okay.
Does it sound good to you?
Perfect.
Anything else
Thank
you would like to know? Shall I go?
Yes. Okay, guys, well done that he came. Yeah. Okay. There is the main thing in this station that he did wrong is the station. The question said the mother, 19-month-old baby, diagnosed, coming here. Why he's in the hospital for? He's here for sepsis. Past history. The nurse has noticed that what is giving him something. Go and talk to her. So you don't need to just spend the 10 minutes in order to reach. That's your task. That your task is go and talk to her about what is given. Your task is not bear the triple D, UB1, UB2, family history, what happened wrong in the family, developmental. No. It's a counseling station about something that is given but is not prescribed in the hospital. So you don't need to go all the way with P1. Does he have any pain, head to toe, any head injury, any rash? When you carry him, is he in pain? Any vomiting, any diarrhea, any abdominal, any eye discharge, any ear discharge? No, that's not the case of the medicine. This is counseling. A child is there. Is he managed for sepsis? Yeah, he's here managed. Okay? They are giving you just background. They are giving you what? Background about him. But what is the task here? What is the station about? The liquid that is given, not the child, how is he, P1, P2, P3 bear, that what he did wrong. Okay. Dr. Mo, but we need, before we start, I will give you now how we start, yeah, but I'm just giving you general. It is not history taking station. Okay? It's not history taking. Okay, so what is the approach? How to start? Simple. You will talk for about 1 minute about the background history. The what? What is the background history? The two words that were given to you, sepsis and neuroblastoma. So my start is, I'm Dr. Fatih Al-Bab, one of your doctors here. Can you confirm your full name? You don't need the mother's age, brother. You don't need the mother's age. Huh? Maybe because she's Salma Haik and you want to build rapport, but no, no. Just mother's name and the child name and date of birth. Yeah. Then you start. I am one of the doctors looking after. Look at the start. I am one of the doctors looking after little Adam, little Ahmed. Is it good to have a chat? Guys, please be simple. Be yourself. Is it all right to have a chat? Yes. Before we go further, now you know that she knows you are the doctor looking after the baby, and you are coming to chat about Adam's health, Ahmed's health, whatever. Can you walk me through? Can you walk me through his health? Why is he here in the hospital for? That's the start. You are assessing her knowledge. Why is he here in the hospital? She will tell you, doctor, he's here for sepsis. So I told you how many words I will use. 2. The sepsis and the neuroblastoma, and that's it. That's my history. Is the background history. It's not his background. Yes, he's here, doctor, for sepsis. Do you know what sepsis is? Has anybody explained to you what sepsis is? Yes, doctor. No, doctor. If no, you tell her. What is sepsis? Infection that spread to his blood, and it is a condition that is serious, but we are managing him, and that's it. But if she knows, she knows. I can see from my note that Adam or Ahmed has a condition called neuroblastoma. Yes, doctor. How's he managing? How's everything? Yes, doctor. Good, doctor. Do you know what neuroblastoma is? Yes, no. Move on. So now it is just the background, the history. It's not a history. Are you lost? Background. And I will tell you why we are using this background. It will help us. Okay, so background history and move on. What is the background history here? 2 words. Sepsis. Why is he here? Do you know what sepsis is? Any healthy issues? Neuroblastoma. Do you know what neuroblastoma is? And that's it. And I will tell you why you're gonna use this background history in this case. Okay. Now, well, is it all right if you walk me through what is Adam or Ahmed given? He's feeding. Why do I ask about the feeding? And that's it. And guys, you see how early I started my station. How early? After 1 minute, I'm starting to talk about the green liquid, the yellow liquid, the blue liquid, anything. So after the background history, right away, this is the purpose of the station. You are here to discuss about what is given, so you will ask here a general question by how's his feeding? Apart from the hospital medication, is there anything that you give him? What do you give him? General question. If she tells you, I give him such and such and green liquid and yellow liquid, okay. What if she doesn't? What if she doesn't early? She said, I give him milk and food. Apart from this, anything else? No. So confront her right away. Well, no, but signpost. Don't say the nurse noticed. If the nurse spying on me, he's my son. Well, as we know, we are caring about Adam's health. As you know, Adam's health is our priority. So we try to keep a close eye on our patients to make sure they are okay. That's why I'm here. As one of the nurses noticed that you are giving him supplement. So why did I signpost? So she doesn't misunderstand me. So she doesn't think I'm here spying on her, or to, you get me or not? Always signpost. Imagine if you are a mother and someone came to you and said to you, well, why are you giving him this? One of the nurses noticed that you're sneaking, and it's not nice. But well, you know, we are caring about Adam. Well, it's our priority. His health is our priority. Well, is it all right to tell me, like, one of the nurses noticed that you are giving him something, and we need to know just to make sure that he's safe and he's okay, and then you start. So basically, what is my history in this station? What is my history? Background history. Call it like this. What is the history? Background. What he has. In this background, assess her knowledge, check that she knows why is sepsis and why is he's here for sepsis, medical condition. Right after the background history, tell yourself, I need the purpose of the station. I need that. I'm not going to go by our family history, no. The purpose of the station, I will start by open question, asking about what is given, feeding, what is given, apart from this, anything given. If she said no, if she's not, what is the second step? Confrontation. Right away. You don't want to waste your time. But when you confront, signpost or not? Yes. Signpost. Signpost, then confront, and then when you confront her about what is given, then the station is now starting in a counseling way. So she told you, doctor, I give him such herbal medication. So now data gathering is about what? Liquid. That's it. Why do you give it? Since when have you been given it? How did you know about it? About this medication? Do you think it has improved the child by any chance? Clear? So these are all questions about what? The liquid. Okay.
Sir, can you repeat the questions?
The questions are, something is given. Since when? What are the contents? Where did you get it from? Do you think it's improving the child in any way? If she said yes, how? Normal questions about what is given. Okay. Do you know why I have assessed her knowledge about sepsis and neuroblastoma? Because it will help me in management. Why did I say to her it is serious early on? Yeah, sepsis, yeah, I'm sorry, and it is serious condition, because I will use it now after doing the data gathering about the liquid and everything. Now I will use it. I will say to her, well, ideally, I should examine Adam. I should make sure that he's all right. Okay? As a guys, that's how much it took from me. How many seconds? 2 seconds. Either I should examine Adam. Don't say I will check his ears and his eyes. No. Ideally, I should run an examination about Adam. But coming back to the liquid that is given, as we spoke, that Adam is in the hospital for a serious condition. For a serious condition. And he's managed for this condition. We are keeping a close eye on what is given to him, as anything might interact with the medication that we are giving him and causes even more serious complication. So why did I use the word, why did I assess her early about sepsis? Infection in the blood. So now I tell her that we are giving him, he's got a serious condition as we spoke. And it's very important to keep an eye on what's given to him, because anything can interact with the medication and it can lead to serious problems. Okay? She will tell you, no, doctor, it's improving, it's causing him. I totally appreciate your concern. I can see you are very concerned, mother. I'm sure that you are giving the medication just to improve your son's condition. But any medications, anything we give to our patients, it has to be certified. It has to be certified from the healthcare regulations. So it is called Medicine and Healthcare Product Regulatory, which is, you don't need to tell this to the mother. It has to be certified and approved by the healthcare in order to make sure that it's not going to cause any interaction with what's given to him. Okay? Now, she will start telling you, doctor, but herbal medication is beneficial and herbal medication is good. Well, I totally appreciate your concern. Yes, you are right. Sometimes herbal medication is beneficial. However, there are interactions sometimes between herbal medications and things we can give to the patient. And you give her one example, any example. We've got plenty of examples. Aspirin with garlic. We've got pseudoephedrine. We've got plenty of things, okay? So you can give her, for example, like aspirin medication can interact with garlic, which is something that can be given and interact with medication. So we need to make sure that what is given is basically not affecting Adam's health. Now, do you want to send the...
No.
Huh?
No. Blood sample.
We can take just a blood sample.
Do you want to send the...
Not a liquid.
Yeah.
We can't send.
Guys, there is no such thing called send the liquid anywhere. Guys, we are in the hospital, we are so busy. Oh, you're giving him this liquid? Okay. Nurse, take this, send it to the lab and let them take the thing. The lab, we send them the blood and it comes after 2 hours and we follow them up with the blood. We're going to send the liquid to be checked. You understand? No such thing called send the liquid to be checked. Clear?
Yes.
So if you read it anywhere, if you do it anywhere, just cross it. Nothing will be sent, okay? And this is the station. Station, we outlined it. Stop giving him, but don't say stop. If you don't mind, please, can you stop giving him that?
Advice.
What you are giving him, because it will affect him. And we can run some blood test to make sure he's okay. And that's it. Station is finished. Okay? We don't send any herbal medication to be checked in the lab. All right? Next station.
Sir, can I ask a question, sir?
Sorry? Can you, doctor, are you on the online course?
Yeah, I am on the online course.
Which group?
It's my exam is in April to
Which
12th
online
of April.
group? Which WhatsApp group?
It's December.
You can you please send it there? Don't worry, I will answer it.
All right, sure.
Don't worry, I will answer it.
Thank you.
Just we need to just keep the stations focused so we finish it. Okay, so by the way, any doctors who are in December group, please you can circulate this message. Okay, please. We have not started your course yet. You can start the material. You can start from day 1, day 2, day 3, day 4, day 5, day 6 in the course, but we have not started yet. So you're gonna have induction session. You will have induction session, and we will meet for online sessions. But we have not started the course yet, so you know, okay? And circulate this message, you guys. Don't worry. We're gonna start early January. We're gonna leave a message. Let's start, guys. I will make an induction session to tell you how to start with the course, how to prepare, and then we're gonna go from there. Okay? We have not started yet. Anyway, that's why I don't even leave messages in December group, because I have not started. We have not. But if you wanna do something, you can read. You can go with the course in order: day 1, day 2, day 3. Anyway, so next station. Next station. Have you seen this green liquid station before? Yes. Very common. People keep failing, and you keep bringing it. People keep, because of the approach, the start. And always start with the task right away. You do not need to go all the way through. The question said, talk to the nurse about? To the mother about liquid. So go and talk to her about the liquid. You don't need to. 1 second. Guys, anybody has a power bank? Thank you very much. Okay, so next. Thank you very much. Yes. Next. Next. Dr. John O'Brien. Very nice name. John O'Brien. John O'Brien. Web viewer. That's his name. Web viewer. Sound like a hacker's name, you know, like John O'Brien. Yes, Dr. John O'Brien. Dr. KKK. Some people they choose names, I don't know, different. Like I see, like even the Facebook people they use a name, you know, like STI. Seriously, I've seen it. Seriously, Herb Zoster. I'm sure you see these things. Like people choose names like yes, huh? Molluscum, yes, yeah, just like Dr. Laila. Nobody wants to practice with me. دكتور جواد.
يا دكتور ما احنا بنموت بعض.
Sorry.
احنا بنموت بعض في الشات.
Why? Why are killing each other in the chat?
Because we all want to try and like we like cut off the way
You all want to try
on each other and you don't choose from.
No, I choose from all of you guys. Oh my God, you don't choose from us. I choose from. Oh, sorry, I couldn't see your hands in the chat box. Sorry, guys. I was not looking at the chat box. Okay. Dr. Sabrina.
Hello, doctor.
Hello, doctor. How are you?
Alhamdulillah. How are you?
I am fine. I'm fine. How's everything? Good?
Yes, Alhamdulillah.
Alhamdulillah. So, don't write down the station. You are on FY2, doctor?
Okay.
You have been asked to visit.
I have been asked what?
To visit.
To visit.
Visit Angelina Jolie. Angelina Jolie at home.
Sorry, again.
Sorry?
Again, can you please repeat?
You are an FY2 doctor. You have been asked to visit Angelina Jolie at home.
Angelina Jolie. Okay.
Yes.
Okay. Okay.
She's 75 years old.
Okay.
She's 75 years old. Diagnosed with multiple sclerosis in the stage. Diagnosis with in the stage multiple sclerosis.
Okay.
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 One second. Yeah. The patient asked to speak to one of the doctors. Yeah, sorry, and she's under palliative care. And she is under what? So in the stage multiple sclerosis, under palliative care. As a part of the palliative care team, you have been asked to visit her at home.
Okay, so she's at home.
Yes.
Okay.
And as a part of the palliative care team, you have been asked to visit her at home.
Okay.
By the way, I had this question. Yeah, it's very common. Talk to her, a very common, one of the most common OSCEs. And Wallahi al-Azim, before I left the cubicle, she was holding my hand. She was holding my hand. You know that song? Darling, hold my hand. She was holding my hand. Seriously, I was that kind with her. She's old, yeah, and she was old. I was that kind with her that yes, she was on the bed, and when I was talking, she held my hand in a mother's son kind of, not holding my hand as a like like that kind of. thank you very much. You know, like, thank you, you're very kind. That's a kind of thing, yeah. So let's. I was looking,
Okay.
holding your hand in the
Bismillah.
cubicle. Bismillah. Okay. Talk to her, address her concerns.
Hello, I'm Dr. Sabrina Reza, one of the junior
And
doctor
by the way,
in
in
this.
the cubicle, there is a form. There's what? I'm
There's,
just saying here because she's not here, so she knows. Let's
there is
start.
a what? Form?
Form.
Okay. Okay. Got it.
In the
Maybe.
action form. Well, there's a form.
Okay.
Start. Can you mute your mic, doctor? What's his name?
Hira. Dr. Hira.
Dr. Hira, can you mute your mic, please, Dr. Hira? Okay, let's start.
Okay. Hello, I'm Dr. Sabrina Reza, one of the junior doctor in this palliative team care. Are you Angelina Jolie?
Yes, doctor. Yes. Yes, it's
Okay,
me, doctor.
Angela. Okay, Angela. Could you please confirm your age for me?
It's 89 years old.
89. Okay. Well, Angelina Jolie, I can see that you're having some trouble. Can you please tell me what is going on with you?
Well, doctor, you know, I am diagnosed in the stage multiple sclerosis, as you know. And I asked one of the doctors, you are doing your best. You are a very good caring team. And I asked the doctors to come and visit me at home because I have some concerns.
Okay. Well, Jolie, I see that you are in so much pain. Is there anything I could do for you right now, or are you comfortable talking to me?
You are doing your best. You have done your best.
I'm really glad to hear that.
Let me talk. And you always have been doing your best.
Okay, Jolie. Thank you for your appreciation. It's really meant for us a lot. Well, Julie, you say that you're having a concern. Can you please tell me about this concern?
You know, I just don't want you to rest on my chest. You know, if at any time I just, you know, feel that much ill, and if at any time my heart stops, I don't want you to jump on my chest, doctor.
So you are talking about this CPR, right?
Yeah, that one. Yes, that one, I think.
Okay, well, before we talk about this, can you tell me about your condition, how you managing and everything, and how been diagnosed this multiple sclerosis?
Well, it's been diagnosed, and it runs in the family, and it's been diagnosed for a while. And you know, you've done your job. You've done everything you could have done. I'm sure there's that you can do, and I think that's it. If at any time, if my heart stops, just let me go peacefully.
Angelina Jolie, we can talk about more, but can you please tell me how you know about this? Who told you about this?
Well, I've seen them jumping on my husband's chest. Like, that was few years back, and I just did not like this experience. I would not like this to happen to me, because even if you bring me back to life, it's not gonna be beneficial. I'm just let me go peacefully.
Well, I'm sorry to hear that, but can you tell me about your husband? What happened to him?
His heart stopped, and they jumped on his chest.
So he is no longer alive, and you are scared that that might happen to you, yeah?
No, he's alive. When they
Okay, I'm sorry.
when they jumped on his chest, when they
Yeah.
jumped, they managed to bring him back to life.
Okay.
But
So
the whole experience was just terrible. And also, I'm coming to an end. Even if you jump on my chest and you bring me back to life, nothing will improve. I'm gonna still have the same struggle with my disease, with my illness.
Well, I can understand your concern, and it is a valid concern. Well, can you tell me who are you with your family? Who's living with you?
I live with my daughter and her
Mhm.
boyfriend, and I live with my husband.
Okay, so are they are helpful to you? They are trying to
Very
managing
support,
good with you?
very supportive, very good,
Mhm.
very caring.
Okay, okay, that's nice. So have you talked about this CPR with your family members who are looking after you?
Well, I discussed it with with my partner, and I discussed it with my daughter, and they agree with me. I should just go peacefully.
Mm-hmm. Okay. Well, Jolie, as I see that your age is 75 and you're saying to me that you are 89, do you remember anything regarding your past
Don't
history
worry,
and
don't
anything?
worry. Whichever age I give you, 89, it's 89 in the question, it's fine. That's not,
Okay,
yeah,
okay. Uh,
yeah.
okay, so have you talked about your condition and the decision you have made with your family members and how
Yeah,
their reactions?
I spoke to them and they agree with me. I just want to go peacefully.
Mm-hmm. Okay. Well, so I think we could do better. We would really like you to have you with us in case we need to do CPR. So are you still on the decision you have made?
I don't want you to jump on my chest, doctor.
Mm-hmm. Okay. So we have a form with me. In case if you change your decision, you can call us anytime or you can contact with any of the hospital staff. Is that will be all right with you?
2
Okay,
minutes remaining.
So
okay,
is that
doctor.
would mm-hmm. Okay. So so here's the form I have given you. You can sign here, and just in case you change your decision, you contact any of us, and we would love to have to, to save your life. Okay.
Okay,
Is there anything I could do for you?
no,
Okay. So since we have time, we can discuss something about your medicine. Do you remember which medicine are you taking, and are you
just
managing your pain good?
pain relief.
Mm-hmm. Okay. Are you managing the pain relief with
Yeah,
the norm?
yes,
Okay.
yes, yes.
Mm-hmm. So any concern, anything?
No, no, doctor. You are very caring. No, doctor.
Okay, that's lovely to hear that. Okay, so I think we have our conversation. In case you change your mind, I'm happy to help you, and our team is happy to help you as well.
All right, doctor.
Okay, have a great day.
You too, doctor. You too.
I'm
What do
done.
you think? Yeah, I'm done too. Uh, sorry? Well, this station is about, and this is how, like, it's a patient who is at home under palliative care in the stage of multiple sclerosis, and you have been asked to go and visit her and address her concern. I am Dr. Fatih Salba, one of the doctors that caring for you in the palliative care team. That's where I'm from. Can I please confirm your full name and date of birth? And we came to our knowledge that you have some concerns. This is the start. She's concerned. She's got some concerns. You're going to visit her. Yes, doctor, I have some concerns. I'm just, fed up and my disease is coming to an end. And, that's how she's starting. Okay. Yes, I can see from my note that you are diagnosed with. I'm really sorry. It is challenging. And can you please tell me how's everything with the management? Is there anything that you need from us? Is there anything that basically expectation in general? Okay, expectation about her illness. If there's anything she can tell, for example, she can say to you, well, I need you to increase the painkiller for me. This is the kind of question I'm asking to a patient who's in this stage under palliative care. Is there anything you're expecting from us? Is there anything that you're hoping for us to do? You understand this kind of question? You think about it, because you don't. Do you know the concern? Do you know the concern in the question? Is it written? No. So that's the kind of question. Is there anything else we can do to help? Well, no, doctor. You are doing your best. You are doing everything. And then the station will start. I just don't want you to jump on my chest if my heart stops. So do you mean that if you needed us to jump and do chest compressions in your chest, you don't want us to go ahead with that? Yes, doctor. Guys, is that a big decision or a small decision? Big decision. But she did not dig much on it. The decision itself. I'm not talking about the psychosocial. I'm not talking about, no. The decision itself, she does not want you to jump on her chest if her heart stops. What is the result if you don't jump? She will die. She will die. Is it a big decision or a small decision? It's a decision that either she's going to die or she's going to be alive. So please, always right away, you will go with some questions that are life-threatening questions. Life-threatening questions mean if you don't ask them, you are not safe doctor. Imagine if she was confused and you took this decision from her. Can you take such a decision from a confused patient? Guys, can you mute your mic, please? Can you be, please, respectful to us and mute your mic? If you're not attending, just leave. So write down at the start, please assess the mental capacity. Do you agree with me?
Yes.
If this patient is saying to you, if my heart stops, don't jump on my chest, and she was confused while she's giving this decision, you will not take the decision. And if you do take it and she was confused, then later on you will be, that your gym cell will be taken. She died because of you. So what is the questions then? Okay, we need to assess it, but what is the practical? So do you know what CPR is? That's CPR is, that's the cardiopulmonary resuscitation, yeah? She will tell you, yes, doctor, it is jumping on my chest and giving me the compression. Do you know what will happen if we don't do it? Do you know what will happen if? Yes, doctor, I will die. Does she have capacity? Yes. How did you know about CPR? How did you? The background. How did you know about? Doctor, I know from this or that, or I read, or, and if we don't do it, I'm gonna die. Is that what you want? When she said to you, when you ask her, do you know what will happen if we don't do it? She will say to you, yes, I will. Tell her, is that what you want? Yes, doctor. And then how did you come across this? How do you know about CPR? And the next question is, what about active treatment? What about? So if you get really ill and we need to give you active treatment like antibiotics to be given, something through your veins, should we still give it or not? Guys, how many questions they ask? 5 questions, which are, number 1, assessing the capacity. Capacity means, does she understand? Does she know the consequences? Can she retain information? Can she answer you back? And in these questions as well, I have already answered the last question.
What about active treatment?
I have asked about active treatment because there is one way not doing the chest compression, and there is another way that patients say, even if I need active treatment, don't give me. So there is something called don't attempt, DN CPR. So do not, D is for do not attempt what? CPR. DN CPR, which is do not attempt CPR, and there is DNAR, active. So some patients, never mind, they just don't want the chest compression. Others, they don't want chest compression and they don't want active treatment. That's why I said to what about active treatment. So 5 questions I have assessed now that she has mental. Khalas. Once I'm sure that she has mental capacity, let's now talk about the decision. You cannot talk about the decision without assessing. So now, she knows what CPR is. She knows what will happen. She knows. Online doctors, they understand me.
Yes, doctor.
Yes, doctor, it's clear.
Are you lost?
No, we're following.
Okay. So now she knows. So let's discuss. That's how important assessing mental capacity is. Now she knows what's happening. Let's talk business. So now you will say to her, I can see from my note that you've been diagnosed with multiple, and it's coming to advanced stage now. Is there anything that you think we can do for you? Again, expectation. Maybe she's thinking of this decision because of something, some pain, some discomfort. She will say, no, doctor, you are doing your best. So guys, the reason, if you noticed, I every station I analyze it really well, so you understand the benefit of the question. It's not just, So now I'm trying to, now she's got capacity. So now I'll try to exclude other causes for which she is willing to die, which is exclude NAI. Maybe nobody to look after her at home. Maybe mood, low mood. Maybe she's in pain. You understand the station now? And if everything is okay, then it's fine with the decision. You got the point of what I'm doing now. So, hi, how can I help you? I don't want CPR. Assess mental capacity. So you know that she knows. Do you know what CPR is? Do you know what will happen if you don't have it? Is that what I want to die? Is that what you want? What about active treatment? Done. She's got capacity. Now I will come back to the decision that she made. Is it she made it because that's it? She's fed up, or is she made it because her husband is beating her up? Her daughter is not looking after her. In that way, I can tell her, carers. You get me? So now I will say to her, so can you please, the question that I've asked now, which is anything you were expecting from us to do? How is your mood? Psychosocial. Who do you live with at home? How's the relationship between you and whoever she mentioned? Like a husband, daughter. Do you get on well? Who's caring for you? Who's looking after you? Are they managing? Clear. Everything is okay, doctor. My daughter, she loves me. My husband loves me. Is they caring for me? Have you discussed this decision with them? Yes, I've done. What did they say to you? Well, doctor, they are happy with my decision. Well, yes, we can go ahead with the decision. So let me fill the form and then go and fill the form. Dr. Mo, where is the form? The form will be on the table. And where is the form in our course? The form is in our notes. I have printed it in the notes. It's there in your notes in the, which branch is in the, either talk to relative or blood result. Either talk to relative or test result. It's the last page, but the page before the last.
It's in the patient. It's in the patient refusal.
Result. Patient refusal, sorry. So it's in the patient refusal, the page before the last. Okay? It's a form there, easy form, simple form. I filled it for you. But make sure when you go to the cubicle, this form starts with patient what? Identity, patient details, name, date of birth. Make sure these patient details, when you get into the cubicle, it will be printed ready. You're not going to fill it. You are not going. It is ready, already printed. You just fill the rest. The rest is easy. I filled it for you in the notes. It is as simple as what is the cause? Multiple sclerosis. What is the cause of the decision? Has it been discussed with family? No, because you did not discuss it. You were not there. Yeah. So it's filled there easy. But make sure before you go there, confirm here that is already written. Very important to say, I'm sorry, I'm gonna have to confirm the identity on the form. Can you please confirm your full name, yeah, date of birth, yeah, and your address. Imagine if you don't confirm identity and you are filling the form for someone else. Medical error. So it will come. By the way, it can be a new station in the exam, Lab 2. Your colleague was filling the form for a patient DNR and he did not check the identity, he filled it for someone else. And then the other patient who by mistakenly was the form was filled for, yeah, his heart stopped and he did not do CPR. And because and it was the wrong form. So my point is, whenever there is a form with the details, always make sure you otherwise it will be medical error station. Yeah. So I will fill the form. The form is there, filled. Don't worry, that's not an issue. And now I will tell her, Alicia, Nicole, whatever. The form has to be countersigned by my consultant. It will be countersigned within 24 hours. It will be countersigned by my consultant. And please, at any time you need to change your decision, you let us know. So that's safety netting, guys. Can she change her decision? Yes, yes she can. That's your safety netting.
She can change her decision even after the 24 hours, right?
Sorry?
Anytime. She can change anytime.
Anytime.
This accepted as phone consultation.
Dr. Mo, you mentioned
phone consultation, or she
can it come as a phone consultation? But obviously the form,
the form,
it's a phone. You're not gonna email it to her. You understand? So, but anything can come as phone. But if it came as phone, it will be counseling. You do what we do, but you're not gonna tell. Okay. Dr. Amin, if you wanna go, you can go. You sure? Yeah. Online doctors. Is everything okay?
Okay.
There was a phone.
Yes, everything is really good.
Do you understand the station now?
Yes, doctor.
A patient wants something to kill himself. Not to kill himself. I'm just giving you as a random expression. Assess the capacity. And by the way, that will bring us to a very good topic. In PLAF 2, if any patient is refusing anything against his best interest, what is the first thing you do?
Assess the mental.
Does he have capacity?
Mental capacity.
Yeah, that's something that will make you pass the station early. If you any station, wow, it's a big topic, easy, beautiful if you understand it, beautiful if you understand PLAF 2. Wallah al-Azim, PLAF 2 is something to understand. It's not something to memorize. Open the cubicle. There's a patient there. And look, I can change the situations and we can do it in the exam, change it. And if you know the principle, you're not lost. There is nothing called to be memorizing, scripted, no. You open the cubicle and the patient, you see, I'll give you 5-6 stations and they all have the same thing. Open the cubicle, a patient who's diagnosed with infective endocarditis wants to go home and she doesn't want to take antibiotic. Mental capacity. What do you mean by that? Do you know what you have? Do you know what we're giving you? Do you know what will happen if we don't give you what we're giving you? You understand? A patient hypoglycemia brought by the ambulance. His blood sugar was 2.1. He was unconscious. He wants to go home. What is the start? Mental capacity. Why? The patient who's hypoglycemia, if we let him go home, what's going to happen? He's going to die. But what if I assess his mental capacity? And I told you, assessing the mental capacity means, brother, do you know what you have? Yes, doctor, I have low blood sugar. Do you know what will happen if you don't stay in the hospital? Yes, doctor, I will die if I go. Okay. Do you know why we need you to give him to give me glucose through my? And if you go home, you're gonna die. Is that what I want? Yes, doctor. Can you go home?
Yes.
He can. It's up to him. But obviously, you will try to say, well, is that what you want? Well, it's life-threatening. But I'm saying at the end of the day, if he's got mental capacity, can he make decisions?
Yes.
Yes. So that's why in lab 2, if there is any station where there is a patient who is refusing something that is against his best, always start with, do you know what you are having? No, doctor, explain it. You know what will happen if you don't have it? No, doctor, that will happen. Is that what you want? Yes, doctor, that's what I want. Mental capacity. And the mental capacity by is checking, does he know what's going on? Okay?
Dr. Moore, during what time would you just, like, Dr. Moore, during what time would you just, hold them back or let them be there, even if they have the mental capacity? I mean, they have the mental capacity, but are there any times where you would just like hold them and admit them if they have the mental capacity? Is there any time you do that?
What?
Is there any time when you would admit them, even if they have the mental capacity and they want to go? Is there any situation where you would just Okay, thank you so much.
Guys, it's rules. Yeah, the patient has mental capacity. Can he decide for himself?
Yes.
That's it. As long as you have went through the procedure, which is why do you want to go, address the concern that for which he wants to go.
What if suicidal, Dr. Moore?
Guys, I think that was discussed. That's you are going into, if the patient is suicidal, suicide, that will go under the Mental Health Act. That's psychiatry. Guys, I'm not discussing the psychiatry now. Okay? The Mental Health Act, if the patient is suicidal, admit by force. You know this.
Yes.
But I'm discussing something else. I'm discussing a patient refusing admission. A patient is refusing treatment. The suicidal patient will have to be admitted under that psychiatry. I'm sure that was discussed. Talking about a patient who's coming to you, he's diabetic, refusing. Infective endocarditis, refusing. A patient who needs the surgery, for example, refusing the surgery. A patient who needs the colonoscopy, refusing. And you go to the, why do you refusing, brother? I'm refusing because 1, 2, 3. Concern. Address the concern. Try to address it as much as you can. Yeah. Like my kids are, nobody will pick them up, or my wife by herself. Then he's still refusing. Do you know what is the colonoscopy? No, it's a camera test. Blah blah. Do you know why we do it? No, we do it in order to find out about what's happening and take sample. And do you know what will happen if we don't do it? No, such and such. And then I don't want to. Then you will just use the senior, and then he can go home. Senior means I'll go back to my senior. Maybe he can have a chat with you as a backup thing, yeah? Because even with the mental capacity, a patient wants to go home and he's well and he has mental capacity, yes, he will go. But who needs review to review the patient?
Senior.
Senior. It's a senior that has to be interfering here, yeah? The procedure of refusal. I'm not saying anything like new, okay? But I made it as it's a mental capacity kind of thing. It's like checking if the patient knows or not. Next station. Guys, are you tired? Are you tired? Yes, you are. I am tired. Are you tired? I'm sure.
Never, doctor, never.
You never?
Yeah.
Dr. Nihal, how are you?
Not good.
I can see, I can hear. Your voice is not really Dr. Nihal, you know.
Yeah.
Never is not coming from your heart.
I'm really frustrated. Yeah, I'm really frustrated.
I know.
No,
but wallahi,
for you, doctor,
wallahi,
it's coming from my heart. But for the GMC, it's not coming from my heart.
wallahi, the thing of cancelling the exams, seriously. Me personally, it's only financial circumstances. For people, yes, they're gonna extend, yeah, the stay in UK, but it is for your own benefit. I had the same discussion a year and a half ago. Wallahi, it is for your own benefit. Because the longer you practice, the better you get, the higher chance from passing first time. Seriously, clap 2. The longer you practice. So people in the academy, if they come every day and they just mix here and they practice here, wallahi, by the time you have the exam, you will be spot on. perfect. You will go for it, inshallah, you will do it. Easy, easy. So it's everything is for a reason. So even if there was a 20% chance that you're not gonna make it, if you had the exam at your time, even if that extension made the 20% chance off, wallahi, it's good. Yes, it will be longer, but it's better than going, failing. What is the step after failing? No, depression. There is a stage between the result and studying back again. There is a, like 3 weeks together, lower, denial, and then you start. So is it, can it happen that I fail? Of course, exam, fail, pass, everything is there. But my point is, people who are in Liverpool practicing, trust me, it's better. It's cancelled, خلاص. And me myself, it did not affect me in a negative way. Wallah, I did not think, people are not gonna come. No, people who are here in the academy to keep practicing. I'm not gonna stop the practice. I'm not gonna stop the Ghalaba mocks. Everything is running. I will keep supporting you guys. I'm not gonna say, okay, this month nobody new is coming, so I will stop the sessions. No, I will pay for the sessions. I will pay for everybody in the academy to come and give you the support. The Ghalaba mock, again, people will come, will be conducted as we are. I don't care. For you to carry on. But the only thing that do not study all day, because we don't know when this will end. Study till 4-5 maximum. When I say study, I mean academy. Come to the academy. Wallahi, the best way. Coming here. Come to the academy till 4-5. Finished. Go home. Do whatever you want. Go out. Go to town. Liverpool town. Try to do something else. Hop. Exam opened in 3 weeks. Start. Khalas. Full time. Okay. Next, and for me, I will keep doing the sessions and we'll keep doing what we do, and we'll keep, other doctors like giving you a negative attitude. Don't listen to them. Just leave them, because trust me, they might be preparing while you are just like, oh really? Yeah, I'm depressed. Really? No, forget about it. Okay, just carry on. Next station. Thomas is a 55 years old. Was planned for angioplasty. Everybody knows the session? Not yet? Okay. Was planned for angioplasty, yeah? Thomas is known to be chronic, or is known to be a smoker for a long time. Smoker. You have been asked to go and talk to him about smoke. Go and talk to Thomas, address his concerns. Who wants to speak to Thomas? Thomas, 55 years old, planned for angio. He's in the hospital. Go and speak to Thomas. So, who wants to speak to Thomas? Nobody? Thomas?
You're going to be Thomas.
Huh?
You're going to be Thomas.
I am Thomas, yeah. Okay. We'll pick one of the doctors to speak to Thomas. Okay. It's a very important OSCE, yeah? And I will give you the best approach for it, inshallah, that will make you, yes, how can I convince? But by the way we're gonna convince this patient about smoking, it's gonna be the same way if I convince her about alcohol. It's gonna be the same way if I convince her about anything. So please use it as an approach. Don't use it as smoking. Do you understand me? The approach. If I want to convince a patient who's having a problem, obviously, to convince a patient, they will tell you, convince him because he's having an issue with alcohol, his liver is damaged, and he's going through a procedure. But convince him about alcohol or smoking, or so use it as an approach. How to convince a patient who will have they will never bring a patient to convince him about a habit unless it has affected him already. And I will tell you now why do I say this, what is the link. Okay, so wallahi guys in the online, like you are really like that many hands. Okay, so there is Dr. Nihal and Dr. Nasheen and Dr. Omar. The three of them. Look how many hands. That's one person. Look how many hands. Look. Sorry? Dr. Nihal, yes. Okay, Dr. Nihal, let's do it.
Oh, thank you, doctors.
Okay, do it. I am Thomas. And
Okay,
I'm coming
I never heard about this. I never heard about this station before, okay?
It's very common. Smoking cessation. Okay, let's start.
Okay.
8 minutes and let's start there.
Okay, hello, I'm Dr. Nihal Youssef. I'm one of the doctors here. Can I confirm your full name and age, please?
My name is Thomas Andrew, and I'm 55 years old.
Okay, Mr. Andrew, I can see here that you are planned for an angioplasty. Am I
Yes,
correct?
Yeah, I had some issues with my heart, and they said I will need a procedure.
Yeah, so did anyone talk to you about what is this procedure exactly?
Well, I had like many heart attack, and they said that I will need to go through this procedure.
Okay, yeah, that's all right, because sometimes the blood vessels that feeds your heart with blood is usually narrowed, so you will need to do some procedures to put some stents in them to keep them open.
Yes.
Am I clear with that?
Yes, yes.
Okay, so do you have any concerns about the procedures so far?
No.
Or
No.
anything do you want to ask about?
Listen, it's a very good start, yeah?
Okay.
No, doctor, I don't have anything about the procedure, doctor, no.
Okay. Well, I have been reading your notes, and I noticed that you mentioned before to one of the doctors that you smoke. So, can you tell me more about your smoking habits? Like,
Oh
what do
my
you
God.
smoke?
Oh my God, I hate these fucking things that you do to me. Whatever anybody sees to me, this is number 5 doctors now. Whenever they see me, they want to talk about smoking. I don't want to talk about smoking.
Okay. I can see that you're upset about this. Do you have any reason that you're upset when someone talks about you smoking with you?
I hate when somebody talk about smoking. Everybody's speaking about my smoking. I don't like it.
Okay. If you don't want to talk about smoking, what would you prefer to talk about?
My girlfriend.
Okay.
What would you like to talk about? You see that?
I meant about your health, Mr. Andrew.
Oh, my health. Okay. Anything. You can discuss anything. I drink Monster. I eat unhealthy food. Why do you talk about it? Why only smoking?
Okay, let's move away from smoking for a bit. Let me about your. You told me that you are eating unhealthy food, right?
Yeah.
So what exactly that you eat that you think that's unhealthy? Like, do you eat a lot of fat?
I eat burgers. I eat crisps. I drink energy drinks.
Okay, and have you been
things?
checking your blood? So do you have any chronic condition that is related to these habits? Like, do you have any diabetes or high cholesterol levels?
No, but I had previous mini heart attack, which means I think it's related.
And what about your exercise? Do you exercise
No, I don't like to exercise.
often?
I don't.
And what about your alcohol habits?
No, I'm Muslim. I don't drink alcohol.
Okay. Have you ever tried any illicit drugs by any means?
Illicit drugs? No. No.
Yeah.
I don't do anything to illicit me. No.
Okay. Okay, Mr. Andrew.
Yeah.
Well, as you are scheduled for the angioplasty,
Yeah.
there are some things that we may make sure to talk to our patients about, because one of the risk factors of your heart attacks is, smoking.
Okay. So it's one of the risk factors.
You don't want to talk about.
No, we can talk now. I didn't know it's one of the risk factors. I didn't know that.
Yeah. So the diet.
I don't know if it's one of
yeah, if you kept your habits and you had the angioplasty, then you might suffer from it again.
No, we can talk about it then. I didn't know it's one of the risk factors for the heart attack. I mean, it was terrible experience. I don't want to have this again.
I'm so sorry that you had to be exposed to these difficult heart attacks before. So can you please tell me what exactly do you smoke and how much for how long?
I smoke shisha and I smoke cigarettes.
Mm-hmm.
I've been smoking for
how many packs?
20 years. No, not how many packs. I smoke like 10 cigarettes only a day.
Okay. Mm-hmm.
For 20 years.
And have you ever tried to stop smoking before?
No, I love smoking. I love it because it relaxes me. It relaxes me in my stressful life.
Yeah. What type of stressors that you might have?
Remaining. Well done, Dr. Nihal. Did you see what she said? I don't care about the time now. But did you see what she said? I said to her, stressful life. She stopped and said, what type of stressors you have? Well done, Dr. Nihal. Well done.
Thank you, doctor.
Yeah, my work, I work as a doctor and it's really annoying because I see some patients that are really stubborn and they don't listen to me. Yeah, but it's fine. I'm trying to manage.
Well, if you felt that this is, affecting you and it urges you to smoke, we might deal with that by offering you some talking therapy or something like that. Is it an option for you?
Okay, that's fine. Okay.
Okay. So after telling you it's a risk factor, are you considering stopping smoking now?
Let me think about that. Now she feels she did not do
Okay,
job.
just to keep your options open and everything.
I will think it's fine. Sorry? Yeah, I'm listening.
Well, I appreciate that you are thinking about it. This is a good step. But just to keep your options open, if you want, I can discuss with you different means that you might be considering if you decided to stop smoking. Is that okay?
Yes, please tell me yes.
Well, first of all, I know that stopping such a habit suddenly is going to be a very difficult thing. It's need a lot of strong will to do it, and I think if you put your mind on it, you can do it. But we can help you with other means, like sometimes we can use something called nicotine patch. Have you heard about it before?
Yeah, it's patches given the hospitals as well. Yes, I've heard about it. But
time is up.
Carry on, yeah.
Well,
I can think about it.
Well, it can provide you with the nicotine that you need to concentrate or whatever you feel that nicotine gives you, but without inhaling the harmful fumes to your lungs and your body.
Yeah, that's very good. Yeah. can think
Some
about it.
people
Yeah.
might even use some gum with nicotine.
Yeah,
And we can offer
that
you
would be
some
good.
gums, you know, too, with nicotine.
Beautiful. Yes, beautiful
And there are
gums.
some
Yeah.
there are some clinics called smoking cessation clinics. If you want, we can refer you to some of them. Is it an option?
Perfect.
Maybe you can consider.
Amazing. Yes, I can consider this as well.
Okay.
She feels she's
Also, there are support groups for smoking, obviously.
yes, perfect, amazing.
Yeah,
I
you have
want to
some
support
strange
as well.
reactions.
Sorry?
Okay. Okay. So, what I care the most is at any point, if you felt that you are relapsing if you started this, or you felt at any point that you're relapsing or that you want to go back to smoking, you can always ask for help.
Okay. Okay, thank you.
Is there
Thank
anything
you.
else that you want to talk about?
No.
خير اللهم اجعله خير.
No, finish by thank you very much.
Thank you, doctor.
I would end this station. Me بقى. Look at this little touch. Good luck with the procedure.
Yes.
No,
Yeah.
I'm talking about something good luck with the procedure. That would be like, good
Yeah,
luck
but
with
because
the.
you were giving me,
You understand me?
I felt I'm
Where is
doing
he going
everything
to?
wrong.
Where is he going to? Procedure. They said discuss it, and they spoke to him about the smoking. I finished everything, and now I finished my station. I wish you good luck with the procedure. Speed recovery. حاجة كده, something كده spice that it's not there, but it will make a difference in, the way in the station, like good luck with the procedure. Anyway, let's start. Whenever, guys, I want you to write it as if I will give you smoking cessation as an example of the topic. You understand me?
Yes.
So I'll discuss the topic now. Okay, and this is an example. Is stopping smoking. So write down that topic will be called, for example, convincing a patient to stop something. So I like to make lab like this, yeah?
Yes.
Convincing any patient to stop anything that is affecting anything.
بعمل أقبله فيه ونوتيلا يمكن يأكلها والشيء لا طرف الحبان.
Dr. Marwa, mute your mic, please.
So why do you tell us this? So in PLAB 2, convincing a patient to stop alcohol because he's had liver problem. Same as convincing a patient to stop smoking because he's having a heart problem. Same, convincing a patient to stop smoking because he's having a chest problem. Same, convincing a patient to eat healthy or to stop the bad diet because he's having heart. So I want you to make it as a topic because it is a topic. But you make it as every station is separate, and at the end it's just 100 station. No, it's a topic. And I will give you a structure that is very easy. Whenever you want to convince a patient to stop something, always start by assessing his knowledge about the condition. That's for you. I actually got it for you, Allah. Okay? Habibi, you are a wolf. So always start by assessing. Write down step 1. Assess knowledge about his current condition. What do I mean by current condition? The liver condition that he's having, the heart condition that he's having, the heart attack that he's having, the heart failure that he's the consequence of what happened. Assess. So this guy, he's here in the hospital for what? Angioplasty because of what? Heart failure, heart attack. So assess his knowledge. Do you know why you are here for? Yes, doctor, for angioplasty. Do you know what angioplasty is? Yes, doctor, procedure to open my blood vessels. Do you know why you're having it? This doctor, I'm having it because of my heart attack. Do you know what heart attack is? It is a stoppage in the blood that's going to my heart. Do you know it's life-threatening? Yes, doctor. That's why, assess knowledge about the condition, which in brackets, the consequences of why you are here. You understand me? Okay. After assessing his knowledge about the condition, step 2, relating the condition to the bad habit. What do you mean, Dr. Mo? Tell him. Now, unless I know that smoking is one of the risk factor for this, why would I stop it if it's not causing me this issue? You understand me? So Dr. Nahal said, do you know that smoking is one of the risk factor? Why? Right away I said, yes. Oh my God, no, let's talk about it. So this is step 2. Always tell him, do you know what causes heart attack? Or do you know what causes heart failure? Or do you know what causes liver failure? Or do you know what causes this lung condition? Why do I give you or? To tell you the whole topic. No, doctor, I don't know. So what causes this heart attack? We have modifiable causes, which things that we can work on, we can improve, and non-modifiable causes, which things that we cannot work on. So the modifiable causes are factors. If we do tackle, there is a high chance of decreasing the risk of you having this again. It is life-threatening. We don't want you to go through this again. Like what, doctor? For example, diet. And I will mention this in every station, because all the stations that they bring all related to this. So it's going to be either heart attack or heart failure, or I can give you a new station now, stroke. A patient is in the hospital to be managed for stroke. Go and talk to him about smoking. Guys, same principle. Brother, do you know what you're here for? Stroke, doctor. Do you know what is, guys, by the way, I've given you now a new station. That's not. But if it comes, doctor, no, it's not new. Do you know what stroke is? I know what stroke is. Explain stroke. Do you know what will happen if you have strokes? No, it's life-threatening. It can cause disability. That's step 1, assess knowledge. Step 2, relate, yeah? Do you know what causes stroke? No, doctor. Modifiable, non-modifiable. And the modifiable things that I can work on. Like what? Like that, and then take the habit that you are here for and start discussing it. So step 3 is discuss the habit. But have you noticed that discussing the habit after he already knows about his condition, after he already knows it's life-threatening, and after he already knows that step 2, that it's a cause. That's why step 3 will be easy, because you have already related smoking to the cause, and you've already showed him how serious the problem is and the consequences of the problem. Guys, if you think of what I gave you, it is a way of talking. It's a structured way of talking. And if you go home and you compare these points with any script, you will never find the word that's not in the script, but the only difference that this is organized.
Yes.
Organized. For you, you memorize any station on its own. No, this is any station, which we have plenty coming for you to discuss a lifestyle. That's how I'm gonna start. Number 1, because they will bring it to discuss lifestyle only if he's already shown his health. So number 1, bring that condition. What is it? How is it? Do you know what it is? Do you know? And always try to scare him in step 1. So step 1, when you are introducing him about the condition, it's life-threatening. We don't want you to go through this terrible experience. It can, so scare him. You are allowed to scare him, because you are not false scaring him. You are scaring him. It is actually the case. So if you tell him from step 1, heart attack, do you know what heart attack is? Do you know it is life-threatening? You are not, don't worry. That's not losing IVS. It is the truth. It is life-threatening. Then I finished step 2. Do you know what can cause? So what's step 2? Cause. Do you know what can cause this problem? No, doctor. Modifiable and guys, all the cases of the lifestyle and all the conditions, heart attack, heart failure, for example, stroke, it's all modifiable, non-modifiable. All of them. The modifiable is all they say. And the non-modifiable all age and sex, age, like gender, like age, old age. Gender, male, more common than female, and family history. And also these things we can work on, make it encouraging. If we do tackle it, we will decrease the risk. If you I don't want you to go through this terrible experience again. Wallahi, it's not all about What do I know about a smoking cessation station? How much knowledge I know? How do I get in to this patient? And how do I convince him really? And how do I talk to him? And how do I start in order for him to be, for example, people approach such stations and the patient doesn't know, okay, what is the relationship between my smoking and heart attack and angioplasty? And if I don't stop smoking, what's going to happen? That's why brother, you are here for this. This is this. And you're going to have the angioplasty because of the heart attack. Heart attack is narrowing in the blood vessel. Narrowing the blood vessel can lead you to die, death. Okay, brother, the causes are 1, 2, 3, 4. One of them is what we're talking about now. If we manage it, decrease the risk of your death, basically. So step 3 is talk about the habit. So in this smoking, I will talk about the smoking. Explore the habit only. Explore the habit only. So what do you smoke? How much do you smoke? In step 3. Because step 3, I said you talk about the habit. So what do you smoke? How much? Since how long? And why? Why do you smoke? Some people will say it relaxes me. Some people will say, you know, so. And then the question number 5 in the step 3. So step 3 is what do you smoke? How much? For how long? Why do you smoke? And the number 5 question in the same step. Have you ever thought about quitting? Guys, it's Blab 2 is like 2-bedroom flat. A flat, 2-bedroom, and the hallway. The hallway is connecting the 2 rooms together. Why do I need to ask about have you ever tried to stop? Because if he did, I will ask him, what are the challenges? What are the challenges? Because for you to be now saying to talk to him about smoking and he tried to stop before that, I mean that he managed to stop or not? He didn't manage. So I want to know why couldn't he manage to make sure to address it this time? Because if there are reasons why he couldn't manage, it will be the same reasons now. Are you lost?
Yes.
So now, after I ask these questions, I will go to step 4. Step 4, managing smoking. Managing what? That's it. So how to manage smoking. 4 words. Write down 4 words. First, smoking cessation clinic. Second, offering him medication. Third, exercise, non-medical treatment like exercise, yoga classes, things to relax him. 4th, support system. Again, how many points did we write?
4.
What are the 4 points? Step 1, where, guys, by the way, look at me. Smoking cessation, it's their job to do everything else coming down. So in the smoking cessation, they will give him medication, they will offer him other kind of exercise, they will offer him support. So smoking cessation number 1, where you can be. Step 2, what? Medication. Step 3, non-medical. Step 4, support. So I will now be talking about step 1, smoking cessation clinic, where now, guys, I give you the point so you don't forget. And then in front of every point, take 2-3 words. 2-3 words in front of every, you know. So, but the point, if you remember them, the rest is easy. Because if I remember the 4 bullet points, I know smoking cessation, yeah, brother, where they can help you to quit smoking. They are experiencing this, and they will make sure you understand. Number 1. Number 2 is medical. I said smoking cessation, medical, non-medical support. Medical, where you can be giving medications like nicotine patch, that will provide you with the nicotine to your blood without the hazardous smokes that you get through the cigarette nicotine patch. So out of medication, 3 words. Out of medication, how many words?
3.
Nicotine patch. And medication like varenicline, you know, varenicline and bupropion is from PLAB 1. If you remember PLAB 1, that smoking, varenicline. Bupropion and varenicline medication that will supply, that will give to the patient who are smoker to decrease their desire to smoke. So how many things opposite medication? Patch, and bupropion. These are names of medication you can tell him. There are some medication that we give like vernicillin. It's something that we give that will decrease your desire to the cigarette, like this. Yeah. What is the third bullet point? Non-medical exercise, yoga classes, things to relax you, other relaxation techniques. Non-medical. And finally is support. There are some support groups where anonymously we can tell you about them, so you can share your experience and share the challenges. And people that have the same experience as you, they can share the experience with you that may benefit you. That's it. And you need to end it, but it's all depending in your willpower. So it means if you have willpower, you're gonna do it. If you don't, regardless, you're not gonna do it. Yeah. And finally, you end your station by give it a thought, think about it, and you are here to help you whenever you are ready. Guys, it's not all the time. You cannot force it. And so, have you stopped? Are you gonna stop? No, I'm not gonna stop. But why? I've been talking to you. Why are you not gonna stop? It's not that kind of stations, guys. Think about it. Give it a thought. If there is anything that's running through your mind, you can come again. We are here. Okay, because we will think if we don't address it now, we fail. No. And finally, end it by good luck. Good luck with the procedure. Is it making sense? So this is a structure of a patient. By the way, we have plenty of stations on this. One of them is like MI, advice about lifestyle. It's very common. Stroke, advice about lifestyle. Smoking cessation, lifestyle. And I can make a new station. I can be sitting here and like plenty of stations, which is not new. But they tell you guys, it's not a script of like either this or no. No, a station, any station. You can make one. For example, a patient who's who's obese, BMI is like 39, and he's refusing to do exercise. New station. So, brother, do you know why you're here for? And the patient is, for example, planned the surgery. Planned this. He's here for surgery, sleeve or whatever, and they found that he's not really complying with exercise. So talk to him. Why he's here for? Do you know what you're here for, brother? Surgery. Because of my weight. Do you know, brother, what is the reason? What is the consequences? Obesity? No, it can lead to heart attack. It can lead to everything. Obesity is a good thing. It can lead to everything. Then you can tell him. So, do you know what will happen, brother? No, doctor. And okay, the reason why the patient will have high BMI, 1, 2, 3, 4, and then start talking about what? Exercise. The reason why, and then talk about the details. Any station 1, 2, 3, 4. But the only thing that will be different is the management, whichever the case is. For example, this case, smoking. So we know. And as you noticed, if you know the bullet point, your life is easy. So if you know the bullet, when you study smoking management, don't read paragraphs. No, speak about 4 things I'll talk about: smoking cessation, medical, non-medical support, and at the end, ended by no, the willpower. Good luck. Ended by the willpower. And the ended by good luck. You understand? So ended by the willpower. And then, whichever procedure is going through, I will show. Imagine how many. I know sometimes it sounds silly. It sounds silly, like really, but wallah, it makes a difference. If I am an examiner and I see everybody's going to talk on the same, okay, and somebody else having a structure relating things, and think about it. What I give you is the logic way of talking. What I give you is a logic way of convincing. But when you guys read scripts, it's not related. Like you go from here to there. What? Here is just a structure. To convince you to stop something, you must know the consequences, and you must know how is it affecting you. And you must know it's related to why you are here. And you must know if you don't follow it, what's going to happen? You're going to die, life-threatening, heart attack. And say it your own way. You go for it your own way. And if you write, for example, if you go home to say, I'll write the smoking cessation station, I'll write it down. Then you use the structure and you write it. You're not going to even miss one word from any, I tell you now, from any script, from anywhere you read, there is not even one word missing if you apply structure. But the only thing that you are organized, your structure. You know what you're doing in other kind of studying? No. If you forget something, you stop. I don't know how to continue. And you cannot convince over there. You convince each other because it's a script and they have to be convinced. Brother, reading the thing. Wallahi, that's really. Yeah, no, but this way is a strong way of convince. It's ethics, a way of talking to the patient. So your homework is studying all the stations that discuss lifestyle. All the stations, because you must have one in the exam. MI, smoking. There is a station stroke, discuss lifestyle, and there is heart attack lifestyle. There is a station called heart attack. It's all on my notes as well. Paris stations. This is the Paris station. So it's your homework to do the last topic and practice it as lifestyle modification. Okay, now I will be sharing with you tonight. I'll be sharing with you December updates. Okay, you know December updates.
Yes.
Okay, so I'll be sharing it in the academy group, the mentor group. Be strong, study in the academy every day. And what is our task for the next week? What is our task for the next week? Tomorrow is Sunday. So Sunday, Monday, Tuesday, Wednesday, Thursday. For example, Friday. Our task that you're gonna come to the academy every day. Okay, anybody new here? I can convert the session into Galaba mocks. Anybody here want the sessions? Anybody? Thursday. Yeah, don't worry, the sessions every week, but okay, so the sessions are there, and other than that, it will be the Galaba mocks. Even in the session day, if you don't need the session, go there, practice. Okay, what is our homework? I want to make you structured now. Your homework for this week coming, after you finish in the academy, read nothing, do nothing. In the academy, Dr. Mo, what should we do for the next week? From tomorrow we're having a dinner here. We're gonna eat together and chill from like 4:30 till like 8, 9 together, just like a relaxing time here in the academy. Okay, I'm gonna bring food and we're gonna do like food and stuff, and that's tomorrow. Before that, before 4:30 and every day, what is the plan? Even if there is a session, I will study at home with my friend. No. Come here, guys. Do your own Galaba mock. If it's 20 of it, it's not much. You are like about 50 doctors here. If it's 20 of you there, 30 of you there, what is our homework for that week? The new updates, December. I will today send you December updates. From the 1st of December, I have shared with you till November.
Yes.
I will share with you from the 1st of December till the 16th of December. Okay? And every day do one exam. Clear? Yes. I think it's a good, every day one exam. So tomorrow, 1st of December. After tomorrow, 2nd of December update. The day after, you understand, do it between yourselves. You have the PDF, read it, everybody choose one station, come here. Even if the session is there, come here. It's guys, it's 16 of us. So 8 in, 8 out. 8 will have 80 stations. Break the other 80 stations, one exam. If you do so, no, I mean, if you do manage to do December updates in the next 8 days, it's you have revised the whole of Lab 2, because I'm gonna share with you about 160 stations. It's Lab 2. You got me? So I will share them with you, with the concerns, with the management, with everything, as you know, and you need to do that. After you finish them, go backwards. Go backward. The other 6 November. After you finish them, backward, and that's it. This is your plan. Exam is tomorrow. Go for the exam. I'm telling you, go for it. So again, this week is December update. The week after, backward till you reach October. Whatever.
Yeah.
Exam is tomorrow. You are ready, inshallah. Should I read that? No. You are ready. So do every day one exam. Fair enough?
Yes.
This is the plan. Please stick to it. I cannot go home and grab you from the house. But fair enough, we are delayed. The exam is delayed. So fair enough, we need to do it from one shot. The good thing is all academies are closed. Most of them are, we need to be active, so we increase our chance in passing, inshallah. Okay. Online doctors, thank you very much. Thank you very much. This session will be recorded, and I will add to the course. I do these sessions. I add them to the course. The course become longer, and people complain. It's long, doctor. And when you don't add it, people say Why you not added? Anyway,
Thank you,
have a
sir.
lovely night, guys.
Thank you, sir.
Dr. Mo,
Thank you, sir.
Dr. Mo,
Yes.
you didn't
Thank
give
you.
me my marks.
Your mark, Dr. Nahal?
Yeah.
5 out of 4, 5 out of 4, 5 out of 4.
Yeah, thank you, doctor.
I mean, I could give her like 9. She was okay. All right, Dr. Nahal. Have a good night.
Okay.
And me also, you didn't have
Thank you,
any mark
doctor.
for me.
You too.
Sorry?
Dr. Muhammad, you didn't have any mark for me.
Dr. Sabrina. We are
Yes.
the government. Give yourself a 12 out of 12. If you do the station again, can you do it
Okay.
better? Can you do it in a better
Yes,
way?
yes,
That's
definitely.
it. That's my main concern.
Okay, thank you.
Have a good night, guys. Bye-bye.